Kok sulit berani ya? Sulit. Ya. Sulit na sa kwarto. Sulit na ako.
Mayong buntag, DepEd Zamboanga del Sur, and welcome to the Division Orientation on COVID-19 Vaccination. To start, may I request everyone to please be ready for the singing of the Philippine National Anthem, to be followed by a prayer.
mga kababayan, ang pambansang awit ng Pilipinas.
A healthy morning to all our viewers today in our FB Live, our YouTube channel, and in our MS Team Live. My salute to our Supportive Schools Division Superintendent, Dr. Maharani Jacinto, our two equally active Assistant School Division Superintendents, Dr. Raymond Salvador and Dr. Romeo Daligdig, our CID Chief, Dr. Juliet Magallanes, and our SGOD Chief, Dr. Ernesto Tardo, our Administrative Officer, Ma'am Zenaida Mago, to all our section heads, division supervisors, district supervisors, and our guest speaker, Dr. Germaline Durias, and to all the teaching and non-teaching personnel of the Division of Zamboanga del Sur. It has been a year now that we have experienced the effect brought about the COVID-19 pandemic, and it has greatly affected the Filipinos in the different aspect of our lives. Even in the delivery of basic education to our learners, our teachers and all other personnel face a great challenge, and we are all hoping to at least slowly go back to our normal life. And this could only be possible if we strictly adhere to minimum health standards and be vaccinated to attain herd immunity. But there has been a lot of commotions and queries about how safe this vaccine will be. Thus, today, the School Health Section of the Department of Education, Zamboanga del Sur, in coordination with the Department of Health, conducts this orientation to allow our participants to grasp understanding on the importance of vaccination and its safety. The DepEd Central Office had already conducted a vaccination orientation through the ACAP Guro, but we intend to do this reorientation to answer more of your queries and to give you informations and not misinformations. Before we start our virtual orientation for this morning, may I request our SGO Chief, Dr. Ernesto F. Tardo, for a short message. Sir?
Hello, good morning. Can I be heard? Hello? Hello? Excuse me, hello. Wala.
Yes, sir.
Can I be heard?
Good morning, sir.
Good morning, good morning. Um,
Yes, sir.
hello,
Can hear
hello.
you now, Sir Tardo.
Okay, thank you. To our school's division superintendent, Dr. Maharani Jacinto, to our two assistant schools division superintendent, Dr. Raymond Salvador and Dr. Romeo Daligdig, our chief in the curriculum implementation division, Dr. Juliet Magallanes, to all division personnel, our district supervisors, school heads, and all teachers, non-teaching and teaching personnel in our division. I would like to welcome everyone to this virtual orientation. Based on our monitoring in our attendance, we are almost 2,000 attendees for this webinar. However, this is very far from our target because as far as our data is concerned, our personnel in the division, non-teaching and teaching and non-teaching personnel, we are almost 10,000. So this is very important, and I hope that especially I would like to address to the district supervisors and the school heads. If ever you have some activities today in your school, you can suspend that and allow your teachers to join on this orientation because this is very important, no, especially on the problem that we are facing right now. We know for a fact that we thought that the COVID-19 problem is already addressed by our national government. But however, recently there is a new cases, no, rising in the province of Zamboanga del Sur as well as in Paganan City, and we are now on the alarming stage. That is why uh, this is what we call the second wave of the COVID-19. However, we cannot afford that there will be another wave of cases or incidents happen, is particularly in our locality, in our province, as well as in our city. That is why there is a need for us to heed on this program, especially the vaccination program of our employees in the Department of Education. Uh, to, uh, in reality, the first orientation we attended, conducted by the health department, the regional health department, um, we are classified. Teachers are being classified into Group B, no, Group B. But however, we are very thankful for our national government, especially our in charge, no, our IETF in the national level, because they consider now the teachers belongs to Group A. Group A na tayo. So hopefully we will be receiving the vaccine uh, on a later so maybe next or succeeding months, no, and that is why there is a need for us to be oriented so that we will know uh, the different questions now which running in our minds, especially for us teachers on what will be the effect of this vaccine. Um, but I hope that after this orientation, or all our doubts, our questions will be answered, and we will decide. No, because we know for a fact that is why we were not able to conduct our face-to-face classes because we are not yet ready. We are not vaccinated and we are not immune to this COVID-19. However, if majority of the teachers will submit for the vaccination, then hopefully by school year 22-23, we can start face-to-face classes. No, so I hope that this orientation will really open our our mind, our understanding in terms to what will be the effect of this vaccination if we are going to submit. However, I know that different LGUs is already conducting orientation on this, but as a department, we have also to do our part to give disseminate information to our personnel so that we will be guided on what you are going to do in response to this program. No, so in advance, I would like to congratulate our health section for spearheading this orientation. And I believe based on our resource person, we also invited resource person, experts in terms of this vaccination program. And I hope that everyone will listen because we want you to have a first-hand information. No, that is why ah, hindi pa tayo umabot ng 2,500 or hindi pa tayo umabot ng 2,100. Again, I would like to request all PSDSS, school heads who are present in this room as well as in the Facebook. Uh, please require your teachers to attend on this orientation so that they will be guided, no, especially katong mga idara na ah katong naka above 60 na murag they are now on the priority list, no, on the vaccination program. Katong naay mga maintenance, we consider them as kuan priority also. So we have to inform them because they are the target now of our vaccination program. So once again, welcome to all participants, and I hope you will give a few of your times this morning, and we will not leave this room or this room without um, clarifying all the issues in terms of this program. Thank you very much, and God bless to everyone.
Thank you so much, Sir Tardo, for always encouraging our DepEd personnel to be part of this vaccination activity for COVID-19. So at this time, we will hear another message from our very own Schools Division Superintendent, Dr. Maharani M. Jacinto. Ma'am? So good morning once again. So we are still having some technical problems here right now. So Ma'am Maharani will be giving her message later on, okay? So we will start again with our orientation. A mass vaccination is one of the major strategies to complement the existing measures and practices to mitigate the spread and reduce morbidity due to COVID-19 disease. With this, the Department of Education enjoins all teaching and non-teaching personnel to be proactive in the rollout of the National Deployment and Vaccination Plan for COVID-19 vaccination. And to give us information on how vaccination works, we have invited a guest speaker from the Department of Health. She is a graduate of Doctor of Medicine at Ateneo de Zamboanga University and had her postgraduate internship at Zamboanga City Medical Center. She is now the Regional Coordinator of the National Immunization of Zamboanga Peninsula. Let us all virtually welcome our guest speaker for this morning, Dr. Mary Germeline Durias Punsalan. Good morning, Doc.
Okay, good morning everyone. So just allow me to share my screen po. Okay. Nakikita na po ba ang screen ko?
Doc Germeline, naka-live na po kayo, Doc. You can share your screen already po.
Okay, okay. Sige, saglit lang. Yeah. Okay na po ba? Is it
Yes po,
visible?
Doc.
Okay.
Okay po, Doc.
Okay, good morning everyone. I would like to thank the Department of Education for inviting me in this orientation for the National Deployment and Vaccination Program. Totoo po no na unang-una po yung ating teachers are initially under priority group B, but because of the recommendations coming from the National Immunization Technical Advisory Group, na-move up po yung ating teachers considering you are all essential frontline workers as well. So this morning po, I will be talking about the vaccines itself. Aside from the vaccines, the whole National Deployment Vaccination Program, what to expect no sa as we start the vaccination, and kahit na ngayon, considering na I believe meron po tayong teachers as well na 60 years old and above, and meron na din po iba na may comorbidity, so eligible na po tayo na bakunahan ngayon. So by the way, my name is Mary Germaine Punsalan, and I am the Regional National Immunization Program Coordinator of Region 9. I am also the focal person of the COVID-19 vaccination program of our region. So, ito po yung gusto kong ipakita muna sa inyo. We actually have this prioritization no, in the context of the scarcity that we are, in the context of the scarcity of vaccines that we are currently facing po right now. So, in this framework no, our objective here in vaccination is unang-una po is we reduce the mortality. Ibig sabihin, we reduce yung namamatay ng mga tao because of COVID disease, and also to preserve the health system capacity of our country. Kaya po, the national government has divided our prioritization, no, our groups, our population into 3 groups. Yung priority A, B, and C. Now, under priority A, meron pa po tayong subgroups nito. Basically, the subgroups po nito is because of the fact that we need, unang-una, we reduce the mortality and we preserve the health system capacity. So, yung A1 po natin, sila na po yung ating frontline workers ng health services. Kaya po, kung mapansin nyo, we also catered to DepEd personnel that are under the school health and nutrition sector. And even the dentist po, sinama po namin sa priority group A1. Next priority po is A2. So lahat po ng 60 years old and above ng mga personnel or ng mga tao, no, they all qualify under A2. For those under A3 naman po, lahat po ng 18 to 59 years old na individuals na meron pong comorbidities. Ano-ano po yung mga comorbidities na to? Pwedeng hypertension, diabetes, asthma, kidney disease, lung disease, cancer, tuberculosis. So, marami po tayong list ng comorbidities. And one of the things lang po that you have to remember is once you have yourself enlisted, no, as a person under A3, kailangan nyo lang po ipakita yung, we require lang po certain proofs of comorbidity. Unang-una po, yung medical certificate nyo stating na ito po yung sakit nyo. Pwede rin po kahit previous prescription ng inyong mga gamot. We honor that as a proof of comorbidity. Pwede rin po yung mga previous hospital records nyo like your discharge summary, your medical abstract, and then pwede rin po yung ating pathology reports. Pathology reports like biopsy results, no, mga ganun. So, yun lang po yung ipakita natin para we can master this, we can have ourselves enlisted under priority group A3. Next po, A4. So, dito na po papasok kayo, mga teachers, no? Frontline personnel in essential sectors, and this also includes the uniformed personnel. So currently po, we are still not catering to A4. However, kung meron po tayong mga personnel, no, under the Department of Education that qualifies as under A2 or A3, pwede na po kayong magpalista sa nearest health center or city health office or municipal health office. Kasi po, kayo na yung next na babakunahan dapat. If ever hindi po kayo nagka-qualify under A2 and A3, then we will just wait po for the rollout of priority group A4. So dun na po namin kayo babakunahan. So if I were you po, no, as early as now, have yourselves enlisted and let the health office, no, categorize you either as A2 or A3, and then the rest of the population A4. Next po is ang A5. These are our indigent population na po. And then priority B are other frontline workers and special populations. And lastly po, yung priority C natin, which is the remaining population. So again, we created, no, the NITAG created these priority groups for us to reduce the mortality. Kaya po nauna yung seniors and preserve the health system capacity. Kaya po nauna yung ating frontline health workers. So I just want to walk you through, no, the whole national deployment and vaccination plan. Ito po kasi yung ating critical steps. Before a certain LGU, no, implements its vaccination plan, no, it needs to complete the process of micro-planning. Kasi if we do not plan, no, sure enough, we are doomed to fail. So in this micro-planning po na activity, there are critical steps that we need to identify. Unang-una po, alamin natin kung sino yung ating eligible population. Next po, we need to know ano yung implementing units natin. Sa hospital po ba tayo? Sa covered court po ba tayo? Sa school po ba tayo? And it's one of the things that I appreciated from the Department of Education kasi they allowed us, no, the health sector, to be able to utilize the schools as vaccination posts. Kasi wala naman din talagang, well, if you look at our health centers, hindi naman din po talaga siya ganun kalaki, especially yung sa mga barangays na natin. So that's why we are very much thankful, no, na we were allowed to use the schools as our vaccination centers. Next po, once we identify the area, we identify the people who will be the vaccination teams or who will be supervising the vaccination post. And then we assign them kung saan sila dapat magbabakuna. After that, we need to identify kung ilan yung kakailanganin natin na vaccines, logistics such as our syringes, cotton balls, alcohol, based on the eligible population that we are planning to cater. And then number 6 po, ito po yung one of the important steps talaga ng ating NDVP or our National Deployment Vaccination Plan, yung cold chain natin. Yung cold chain po natin is very important because the vaccines need to be stored at a very specific temperature in order to maintain its potency. So pag, let's say for example, Sinovac na vaccines, it needs to be stored at +2 to +8 degrees Celsius. So kung bababa siya sa +2 or lalampas siya sa +8, our vaccines would no longer be potent. Ibig sabihin, it cannot be that effective to produce the needed immune response ng katawan nyo to combat COVID disease. Next po, the delivery of the logistics. Actually, based sa NDVP, once we deliver the vaccines to our respective LGUs and implementing units, within a span of 7 days, dapat maubos na po yan siya. And then the vaccination plan. This is also an important step, kasi we need to know kung sino-sino dapat yung babakunahan for that day para po ma-anticipate natin kung ilan yung kakailanganin natin na bakuna, for that specific bakuna center. And then also, we develop a communication plan and do social mobilization activities so that we can increase the demand generation, so that people will, it will allay the fears ng mga tao with regards to the COVID vaccines. Kasi it's a very, very heated topic this year, yung ating mga COVID vaccines. And marami talagang nagsilabasan ng mga fake news sa internet. And sometimes we are very, very gullible to believe those types of fake news. So kailangan po that even right now, as we are oriented with the vaccination plan and the vaccines itself, we should also be accountable to share those information, especially to the people that we love. The next po is the preparation of a supervision and monitoring plan and scheduling. Kasi po, and also to continue yung AFI and ASI management, surveillance, and response plan. So, AFI means adverse events following immunization. So, actually, kung iisipin nyo, lahat naman po talaga ng ating mga gamot, bakuna, they all have adverse events. But considering po that the vaccine is a novel vaccine, bago po talaga ito na bakuna, we need to all the more strengthen our surveillance in terms of its adverse events para po ma-monitor po natin. And should there be untoward events, we will be able to address them accordingly. So kaya po we also prepared an AFI management, surveillance, and response plan. And then lastly po is the waste management plan. Kasi po part of this whole implementation is to handle as well the waste, yung ating syringes, the vials that we use, Mind you, itong vials na ginagamit natin sa vaccination ngayon, after they are used, they should not be thrown away. We have to get those vials again from the provincial health offices. Then we will account kung ilan ba talaga yung nagamit nila ng mga bakuna. So, just a few facts about COVID. Alam ko pong alam niyo na ito lahat. Alam natin na yung COVID is caused by a virus we call the SARS-CoV-2. And it's spread by a droplet. So, if I sneeze, if I cough, and then I have COVID, I'm already spreading the COVID to the people near me. Also, if I touch, objects that were previously touched by someone na may COVID, tapos hawak-hawak niya pa yung bibig niya, yung ilong niya, ganyan. So, na-transfer niya na yung virus from his hand to the object that he touched. So, if I touch that, I am also touching na rin nandun na rin yung virus. And then, once I touch my face again, inaayos-ayos ko yung mukha ko, and the virus is already there. So, yun, that's a potential for you to be infected na with COVID. So, alam na po din natin, I'm sure we all know ano yung symptoms ng COVID. I'm sure din po, I think a couple of us here have already experienced this disease firsthand. Alam ko pong hindi siya madali. Very uneasy siya. Not only the fact that you are experiencing the symptoms of fever and cough and sore throat and no sense of taste and no sense of smell, but all the more the isolation, no? Alam ko mahirap talaga mag-isolate. Ikaw lang mag-isa, and then yun. So there are a lot of things, no, to consider when we think about COVID. Actually, no, ito yung the unpredictability of this virus. Kasi the symptoms may appear 2 to 14 days after the exposure of the virus. So, for example, I was exposed to someone with COVID today. Pwede talaga na after 5 days, wala pa yan akong symptoms. So, parang it varies from 2 to 14 days. Kaya po ni-recommend natin na if we are in close contact with someone who has COVID, he or she should also be isolated, no? Should quarantine himself for 14 days. Kasi once there are symptoms that appear from that 14-day period, dyan, maghinala na tayo, most likely talaga, that could be COVID na. However, kung wala po within the 14-day period, then it's safe to say that we are safe, no? Ganun yun siya. Just a few reminders, no, ng ating preventive measure. We stay at home if we can. If we need to go outside our houses, we wear our face mask and face shields. We distance ourselves from the people. No, we should maintain that 1 meter distance. Ano yung reason ng 1 meter distance na yun? Kasi if ever that person coughs or sneezes, yung 1 meter distance would be a protective space for you kasi hindi aabot yung kanyang droplets, no, at a span of 1 meter. So yun. Then also we should continuously wash our hands, no, soap and water, or if we have alcohol with us, we should always use the alcohol. So ito po yung ating COVID vaccination strategy. So currently, no, we are already starting with the senior citizens, and there are also LGUs, no, that have devised, no, and adopted certain strategies just to have their senior citizens vaccinated. So, an important aspect po talaga ng ating vaccination strategy is the social mobilization. So, the people need to be informed na mayroong bakuna, ito yung effects ng bakuna, ito ang advantages niya, ito din yung possible na mga side effects niya. So, these people, they talk, no, to the people around them so that maging interested sila to get the vaccine. The LGU then will, or let's say the barangay then will assign, parang arrange, no, for them to be able to be transported to the fixed point vaccination post, no. So, parang meron na akong narinig na LGU na what they do is that they actually gather yung kanilang mga senior citizens and then they transport them going to the health center para po mabakunahan sila, and after na naman mabakunahan sila, pinatransport pa rin nila pauwi. The case nga po of Isabela, they had to use boats, no, kasi meron po sila island ng mga barangay doon, so they had to use boats to transport their senior citizens to the mainland for them to be vaccinated. So, ito po yung ating floor plan, no? Para lang din po you can have an idea, you have a picture kung ano po yung nangyayari sa loob ng isang vaccination site. So, unang-una po, meron po tayong waiting area, and once you are called po, dito po tayo sa registration area wherein i-verify po yung inyong pangalan, and then afterwards, you go to the counseling area. And here in the counseling area, there is a person assigned here to attend to your concerns, no? Should you have any questions, they are there to answer. So, dito din po sa counseling area, may papalabas din po na video about vaccination. And then, once it's your turn to be called na sa screening area, punta lang po kayo dito sa screening area and have your BP and temperature and your vital signs checked. Dito din po yung ating doktor magsistay. So, the doctor there will be the one to check, no, if you are eligible to be vaccinated for the day or if you are not. So, ano-ano ba yung mga reasons kung bakit hindi ka papayagan ng doktor na bakunahan for that day? Let's say, for example, meron kang ubo, meron kang sipon, nilalagnat ka, wala kang sense of taste, sense of smell, you are complaining of headache. So if you have those symptoms, most likely your doctor will defer you from vaccination. he will advise you na tapusin mo muna, you recover muna from that illness, and once you have fully recovered, that's the time you can go back to be vaccinated. Ano pang isang reason that you will most likely be deferred? One is if you are pregnant in the first trimester. So the vaccine kasi, just like any other medication, no, meron talagang mga gamot na hindi dapat natin ibigay sa first trimester ng pagbubuntis. Kasi that's the time, we call that the organogenesis. That's the time where the organs of the baby is being formed, yung brain, yung heart. So just to be safe, no, and just like any other vaccines and any other medications, no, kaya hindi muna natin ibibigay sa first trimester. However, if nasa second try ka na or third try ka na, then it's okay. We can give the vaccine on the second and the third trimester. It's given na po kasi na by the second and the third trimester, all the vital organs of the baby have already been developed. So yun, ano pa ibang reasons na probably ma-defer ka? If you have received a COVID vaccine, if you have received any type of vaccine in the past 14 days. Say for example, 5 days ago, nagpabakuna ako ng anti-tetanus. So I should receive my COVID vaccine 14 days after pa. Same as anti-rabies, flu vaccine, no? So yung principle natin dyan is the interval between a COVID vaccine and a non-COVID vaccine should be at least 14 days. For the sole reason na wala pa masyadong studies na ginawa with regards to that. Kaya the safety net there is the 14 days interval. Ano pa ba reason na ma-defer ka? If you receive monoclonal antibodies or plasma, for example, nagka-COVID ka and part of your treatment was the use of plasma and monoclonal antibodies. So, hindi ka muna pwedeng bigyan ng COVID vaccine. You can only be given the COVID vaccine after 90 days na po. So, yun. So, if you have, let's say, for example, may cancer ka, may HIV ka, or you have undergone a transplant surgery and you are taking, usually after transplant surgery, you need to take steroids, ganyan. Actually, you may be vaccinated, but we need to have a clearance from your physician. So if your physician has given you the go signal, meron talaga siyang paper to show that you are cleared for COVID vaccination, then you may be vaccinated na po. So usually may iba nagtatanong, what if I got COVID, no? What if I got COVID? Can I be vaccinated? Based on the recent guidelines, that the Department of Health has released, that's Department Memo 2021-0175. So sa memo na yun, it stated there that if you got COVID, if you previously got infected with COVID, and given that you have completed your treatment and have fully recovered, you may be vaccinated na po afterwards. No need to wait for 2 weeks, no need to wait for 3 months. You can be vaccinated so long as you have fully recovered from the disease itself. So yun, pwede na. Pwede po, yung mga nagka-COVID before, you can be vaccinated po so long as you have fully recovered from the disease itself. So, okay na, na-screen ka na. Sabi ng doktor doon, sige, pwede ka nang bakunahan. So in the vaccination area, we have nurses assigned there to vaccinate you. After you got vaccinated na, meron po tayong tinatawag na post-vaccination monitoring. Dito po sa post-vaccination monitoring, you will wait for 15 minutes to 30 minutes. Depende po sa kaso nyo. Let's say, for example, sa screening area, nalaman ng doktor na may history ka ng asthma or asthmatic ka. So, usually, cases like this, yung may asthma, yung may allergies, they can be vaccinated. But pagdating po sa post-vaccination monitoring, they have to wait for 30 minutes. Yun lang yun. If you have asthma, if you have allergies to food, medication, or allergic ka sa itlog, pwede ka lang bakunahan. But in the post-vaccination monitoring area, you have to wait for 30 minutes for you to be observed. So yun lang yun. If ever you're clear naman, like you are clinically healthy, wala kang problems, you will only have to wait for 15 minutes at the post-vaccination area. So yun yung ating side. So actually, ito na yung sinabi ko kanina, in-explain ko na isa-isa. So ngayon, let's go to the vaccines. So ano bang vaccines na maganda? Ano bang vaccines ang dapat para sa akin? So yun, no? We have those questions. We also have our preferences as to the vaccines that we want. I just want to explain, no, na we have different types of COVID-19 vaccines. Meron yung inactivated or weakened virus vaccine. So from the word itself, weakened, virus siya, COVID-19 virus siya, pero pinahina talaga siya to the point that it cannot give you the disease itself. However, even if it's weakened virus, it still enables your body to mount an immune response against the COVID disease. We also have protein-based vaccine. So, hindi siya virus. Protein siya, protein ng virus, ang nilagay, so that your body will mount that immune response. Meron din tayong viral vector. Etong viral vector, COVID siya na virus, but it is tweaked and genetically engineered, no? Meron siyang nilagay na ibang klaseng virus, no, doon. But still, no, it's weakened as well, and that it's weakened enough not to give you the disease, but still it gives you an immune response against the virus itself. Next po is yung RNA and DNA. So, itong RNA and DNA na vaccine, these are also genetically engineered. So, kinuha yung RNA and DNA ng COVID or yung SARS-CoV, and they tweaked it a little bit as well. And for it to mount an immune, once introduced into the body, it mounts an immune response na. So next is, ito. I don't want you to look at the narrative dyan, no? Gusto ko tingnan natin itong picture. Kasi, itong picture na to, it's very, very simple explanation. So, this is the case of mRNA vaccines. Yung mRNA vaccines kasi, example nito is the Pfizer and the Moderna. So, let's say, eto, meron kang bakuna, meron ka ng syringe na may laman ng vaccine. So, etong syringe na to, once injected, yung mRNA dyan, pupunta siya sa loob ng isang cell. Once na sa loob ng isang cell, maghahanap siya ng isang protein na tinatawag nating ribosome. And this ribosome will release another set of protein. We call them the spike proteins. And itong spike proteins, once released into your bloodstream, will be able to trigger, no, your cells, no, we call them the memory cells, to create the antibodies. Ito na po yung sa baba, yung antibodies, to mount an immune response against the virus itself. So, since the protein came from the mRNA ng COVID, ng SARS-CoV, no? Ng SARS-CoV na virus, so yung antibody na na-produce is also against that SARS-CoV na virus that was initially introduced in your body. So, yun ang concept nun. Ito yung mga different kinds of vaccine, no, that the country is eyeing to procure. Currently, we already have the Sinovac. Ngayon po, yung Sinopharma, it's still under investigation kasi maglalabas pa lang ng emergency use authorization for it, and also the Covaxin, no? So, these types of vaccines actually contain the weakened virus. Kung isipin nyo kasi, yung weakened virus, if you have children, no, they were vaccinated with the measles, rubella. So, yung paano ginawa yung MR na vaccine, measles, rubella na vaccine, weakened virus din yun siya. So, that's how the Sinovac, the Sinopharma, and the Bharat vaccine were also created. Weakened virus yun sila. This is the most traditional form, no? The traditional process of making a vaccine. So kaya in terms of the process it is made, no, it has already been proven kasi kahit yung measles ganito din yung pagkagawa, and throughout the years wala naman din tayong problems, no, with regards to those type of vaccine. Ito yung mga bagong new methods of creation of vaccine, no? Yung gagamitin natin yung DNA or yung mRNA at saka yung protein. So, ang example dito, we have the Novio, we also have the Pfizer na BNT162b2. Ito na po yung ngayon, yung Comirnaty na vaccine. That's Pfizer. Ito na po yung vaccine na nangangailangan ng negative 70 degrees Celsius or the ultra cold chain. Kaya po wala tayong Pfizer na Comirnaty dito sa Zamboanga Peninsula because we do not have the capacity to store that kind of vaccine. Kasi yung ref, no, yung cold storages natin are only able to cater up to negative 20 degrees Celsius. Hindi niya po kayang mag-cater up to negative 70 to 80 degrees Celsius. And even, no, Novavax is also this type of vaccine. However, yung Novavax, kaya lang po natin i-store ang Novavax kasi 2 to 8 lang din po ito. Ito yung ito din yung sabi ko na may other types of virus ang ilalagay to be able to combat that immune response or to be able to produce that immune response. So, yung naalala niyo yung viral vector na sabi ko kanina, yung AstraZeneca, yung Janssen na vaccine at saka yung Gamaleya or Sputnik 5, these are all viral vectors na vaccine. So, parang paano sila ginawa? It's actually the combination of a part ng virus ng chimpanzee adenovirus, part ng virus ng adenovirus 26 and adenovirus 5. So, minix yun sila, no, to create this vaccine. Still, its goal is for the body to mount an immune response against the COVID vaccine. So, ito po yung this was released in December 2020. I just want to highlight po yung ito sa efficacy natin. As you can see, itong efficacy kasi natin, this is, I want you to understand na yung vaccine efficacy means the efficacy of the vaccine to prevent the mild symptoms of COVID. So, hindi po ibig sabihin na kung 95% ang vaccine efficacy, 95% ka na hindi magkakaroon ng COVID. Ibig sabihin lang doon is 94% ang chances mo na hindi magkaroon ng mild symptoms ng COVID. You will still have COVID if you have the exposure, but then the severity of the case will be very, very less likely. Pwede pong maging asymptomatic ka lang. Ganun po yung ating explanation sa vaccine efficacy. So, in this case, 95% ang vaccine efficacy ni Pfizer, 94 si Moderna, 70 si AstraZeneca, and Gamaleya is the Sputnik 5 na, so 91%. So, etong vaccine efficacy, ito po yung chances of us not developing the mild symptoms, the mild type of COVID disease, no? However, ito yung maganda ng lahat ng ating mga bakuna. All of these vaccines, mapa Sinovac ba siya, mapa Johnson & Johnson, AstraZeneca, they all prevent the severe type of COVID at a rate of 100%. So rest assured that when you get the vaccine, you will never have the severe type of COVID disease. 100% niya pong nape-prevent yung severe type of COVID. So, as you can see sa baba, meron po tayo ditong row on the storage. Nandito po sa baba. So, kita nyo po yung Pfizer is negative 70, Moderna is negative 20. So, kaya pa ng refs natin. So, hopefully, if the national government will give us this, then maganda din. Currently, the AstraZeneca, I will explain later yung issue nito on blood clots. And then also the Gamaleya Sputnik, it's a 2 to 8 degrees. So, we can cater to this. So, ito, I just want to highlight yung itong interval. So, yung Novavax, yung sabi ko kanina, still 2 doses, 0 and 21 days. AstraZeneca, 2 doses po siya, but the EUA ng FDA is at 8 weeks and 12 weeks. So, meaning if you got vaccinated with Astra ngayon, you will be vaccinated sa second dose at after 8 to 12 weeks pa. So, ganun siya. Pfizer naman din is 28 days po ang ating interval. Moderna is still 28 days. Sinovac is 28 days. 2 doses po siya. And then Gamaleya, similar lang din, 2 doses and it's is after 21 days. Okay, so this is an article no published by Dr. Edsel Salvania. These are very important points that he was able to raise no with regards to the COVID vaccine. Yung vaccines kasi natin, they work in three possible ways. Una-una, they prevent the severe disease and the possibility of death. And second, they prevent the symptoms. And then third, they prevent the infection. Yung concept kasi ng preventing of infection, this is the thing that we dream about. This is the thing that we want. This is the thing that we need. But then, this is the thing na pinakamahirap gawin. Kasi, ito kasi, it will take years no for a vaccine to be, it will take years for a vaccine na ganito to be able to produce this type of effect, which is hindi pa nagagawa talaga ng majority ng ating vaccines ngayon. Under study pa lang talaga sila lahat. However, no, because the need to produce the vaccine no, in a short period of time, nakapag-release sila ng ganitong klaseng vaccine to prevent the severe disease and to prevent the symptoms. So, ang sinasabi ko talaga, what is the best vaccine? For me, the best vaccine is the vaccine that's available. Kasi kung isipin mo, would you rather have that certain amount of protection no with this type of vaccine than have no protection at all? So yun lang yun. So isipin mo, I'd rather get this 50% na protection rather than having zero protection at all. So based naman din sa WHO, yung requirement natin ng COVID vaccine efficacy is at least 50%. So kung tingnan nyo naman yung data ng ibang vaccines no, the clinical efficacy of preventing mild disease no of, let's say, Pfizer, it's at 95%, Astra it's at 62 to 90. Johnson & Johnson, ito ang maganda actually sa Johnson & Johnson, single dose lang siya, so once ka lang babakunahan and you will have the immune response na or the antibodies after 2 weeks. Its efficacy is 60% in preventing mild disease. Novavax at 89, Moderna at 94, Sinovac at 50 to 91%, and Gamaleya at 91.6, and Sinopharm at 86%. So, kung tingnan mo, lampas naman din sila sa ating 50% na minimum requirement. And it's just, eto lang, nagbabari lang talaga sila sa prevention of mild disease. Kasi kung tingnan natin yung profile nila in preventing the severe disease, it prevents the disease, at a severe type of disease at 100%. So, what is the best vaccine talaga? The best vaccine is the available vaccine. The vaccine that can offer us a certain amount of protection than no protection at all. So if we deploy these vaccines to prevent severe disease no, sa vulnerable population, we decrease the deaths of COVID by 90%. Ganun kataas. And that's the reason why inuna natin yung elderly, inuna natin yung ating mga frontline workers, and those with comorbidities. Kasi mas mataas yung chance ng mga taong ito na mamatay sa COVID if they do not have the vaccine. So yun. Ano ba? Ito, I think this is the big question ng lahat, no? What are the untoward side effects of the vaccine? Just like any other type of vaccine, no? Yung untoward side effects natin ng COVID-19 vaccine, similar lang sa flu vac, no? That you will also have fever, you will have sore throat, you will have body weakness, you will have cough and colds, and mga ganun. So it's just the same as the other vaccines that we have. So we really expect those types of side effects. Kasi po, it would mean that your body is already responding to the vaccine. So that's a signal of your body creating those antibodies against the COVID disease. So what about yung sa akin, Doc, what about yung mga blood clots ng AstraZeneca and Johnson & Johnson? You have to take a look at the facts. Kasi po, yung nirelease nila na study on AstraZeneca on patients with blood clots, that was studied no na 1 out of 10 na mga tao out of 1 million doses that were given had the experience of blood clot. So isipin mo kung 1 out of, let's say 10, that's 10 out of 1 million doses given, konti lang talaga siya, di ba? So kung isipin mo, the risk of dying from COVID for people more than 60 years old is 1 out of 10. So mataas ang 1 out of 10 compared to the 1 out of the 1 million doses. So alin dyan yung mas pipiliin mo? Would you rather have the 1 out of 10 chances, or would you rather have the 10 out of a million chances? So yun yung ano natin, the reason also why there were reviews and pauses on the AstraZeneca na vaccine, no, is because they just want, these are just safety mechanisms to show na we are really safeguarding the people, no, and working. And as of this right, actually as of yesterday, the National Vaccine Operations Center has already informed us that we can continue giving the AstraZeneca for 60 years old and below. However, there are certain guidelines lang that we need to follow. So, yun yung ano natin yung stats natin. It's just 10 out of a million who develop the blood clot. So, anong pipiliin mo? Would you rather risk the 10 out of 1 million, or would you rather have the 1 out of the 10 chances of dying from COVID-19? So that's something to ponder, no? And I hope at the end of this, actually it's my last slide, I hope that at the end of this presentation po, you are able to magmuni-muni kayo. You think about it, you decide if you want to be vaccinated or not. It's not, the vaccination is not a requirement, but we from the health sector, we highly encourage that you all get vaccinated. So that ends my presentation. Maraming salamat po. Magandang umaga.
Mic on. Mic on ta, mic on.
Okay, thank you so much po, Dr. Germaline. So we are very much thankful po, Doc, no, for your time and expertise that you have shared to us this morning on giving us information about COVID-19 vaccines. Doc Germaline, do you still have time po to stay with us a little bit to answer questions coming from our live audience today in our webinar po, Doc?
Yes, ma'am. Sorry,
Okay.
I can answer lang po. If
So we
okay
have
lang po, mga
questions
5 minutes
from
more
our
lang.
live viewers this morning. This is coming from Suminot District po, Doc. One of our teachers is asking if this COVID-19 vaccine, is it compulsory po for all our DepEd personnel?
Hindi lang po siya sa DepEd personnel, but to the whole Filipino population, we are not making the vaccines compulsory po. But we, from the health sector, no, we encourage everyone to be vaccinated po.
Okay, so thank you po, Doc. Another question po, Doc, is if the vaccine has COVID RNA, how can it fight COVID virus if they have same RNA? Where in fact, same origin ra sila. Magka-COVID na hinuon daw, unta.
No, as what I have said po kanina, na yung RNA na nilagay sa ating vaccine, these are all weakened and inactivated. So these are not enough to cause COVID sa isang tao, but just enough for a person to mount that immune response against the disease. So hindi kasi yan siya like, even if you, let's say, you just put something in it, magkaka-COVID ka na agad. Kasi we still have a working immune system in our body eh. So, even if you put just a little bit of it, our body is that hyper enough to create that immune response against it. So, kaya po, may reasons po kami for deferral, like magkaroon ng cough, magkaroon yung mga nagkaroon ng colds, may fever, ganyan. Kasi it signals us that the body is not in a good immune response state. Weak ang kanyang immunity. So, if ever we give the vaccine, baka po magkakaroon siya ng adverse effects. So, kaya po, yun yung explanation namin na, kasi kung isipin nyo ha, even the measles vaccine, even our polio vaccine, they all have that tiny bit of DNA, RNA, genetic component ng polio na virus at saka ng measles na virus. But then where did it get us? It got us to a polio-free state, no? And ngayon currently working to have a measles-free state ng ating region. So that's really how all the vaccines work. Even tetanus, even anti-rabies, meron po yan silang konting rabies na virus na component. Just enough for our body to create that immune response. So I hope we all got that concept po.
Maraming salamat po, Dr. Malino, for clarifying all these mga misunderstanding from our viewers. No? At least they have been informed already as to how this vaccine works. Another question po, Doc Germaline. Will there be any adversities if the person to be vaccinated is allergic or sensitive to antibiotics?
Yan po yung in-explain ko kanina na if you have a history of allergies to medicines, any type of medicines, be it paracetamol, be it cotrimoxazole, mga ganon, you can still be given the vaccine. However, post-vaccination, you need to be monitored for 30 minutes. So, based po sa rollout ng aming vaccination ngayon, those with history of asthma and allergies, so far wala naman din po sa kanila kasi we have also our surveillance eh. And we also take note of those na merong mga ganong history. So far, wala po kaming recorded data as to those people that develop a severe allergic reaction after being vaccinated with COVID-19 vaccine. So yun po.
So I guess we still have another one question po, Doc.
Yes.
Is COVID vaccine safe to everyone? What are the possible effects of the vaccine in our body?
Yun na po yung sabi ko kanina, no, na all vaccines, no, be it a COVID or a non-COVID vaccine, they all have risk. But you always have to consider if the benefit of having the vaccine outweighs the risk. So the usual adverse effects, no, will happen. You may have cough, you may have fever, you may have colds, you may have weakness ng iyong katawan. Ako, when I was vaccinated, I had during that time after I was vaccinated, I was so very weak. So, pero isang araw lang yun, the day after, naging okay na ako. That signaled me that my body is already mounting that immune response. Kasi yun yung natin signs natin na nagre-respond yung katawan natin if nag-develop tayo ng ganun na mga effect. Yung iba naman, they had sore throat, pero hindi naman siya yung tipong COVID agad. So yun talaga yung typical natin na i-expect when we get vaccines. And it's not just true for COVID vaccines. Even our flu vaccines, we also get those type of adverse effects. So, what it does to our body, as what I have explained later, the vaccine creates antibodies. Etong antibodies na ito po talaga yung cells, yung particles that specifically fights the disease. So if you have antibodies against COVID-19, and if ever you have exposure to COVID-19, so these antibodies will now fight the virus that's inside your body. So yun po yung mechanism ng ating vaccines po.
Okay, so maraming salamat po, Doc Germalino. I know medyo may paulit-ulit na iba, pero at least talagang ina-emphasize talaga natin how safe is the vaccine to be given to our personnel and to everybody who is willing enough to be vaccinated. Doc, meron pa po talagang isang question.
Sige, go ahead lang, ma'am.
Time po, Doc, ha?
No worries.
So here, there are still two pala, Doc. After one is exposed to COVID-positive person, is there a need for a swab test or just have that person home quarantine for 14 days?
Quarantine lang po. Depends po kasi it depends on the protocol of your workplace. But per guideline, after you are exposed to a COVID positive patient, like for me, in my case, I was exposed to a COVID patient, kaya nasa bahay lang po ako ngayon, nagwe-webinar. So I need to go on a 10-day quarantine. Because that's the protocol of our office. So depende po yan sa area nyo. It's 10 to 14 days. But then in my case, because I don't have symptoms and it's already my 5th day of exposure, I am not advised, or I was not advised rather, to undergo the swab test. I will just have to continue and complete my quarantine period po. Kaya andito lang ako sa bahay.
Okay po, Doc. Thank you for that, Doc. Another question po, Doc. Is there any possibilities that a person who is fully vaccinated with the high efficacy rate of COVID-19 vaccines, she or he may be infected again with the said virus po?
Yes, meron pa rin po. Again, I would like to reiterate that the efficacy there that I presented is the efficacy against the prevention of mild disease. So even if 95% yung clinical efficacy, let's say for example Pfizer, it has a 95% clinical efficacy in preventing the mild disease. May 5% chance pa rin that you will get that mild disease. And one thing you have to understand with the viruses, they are all evolving. So kaya nagkakaroon tayo ng bagong strains kasi nag-e-evolve po talaga siya. So there's still a chance that you get infected, but the bottom line there is that the infection will not be severe. The chances of you having the mild symptoms will only be at 5% if ever Pfizer ang nabigay sa'yo. But the chances of you not exhibiting any symptoms at all, even if you have COVID, would be 95%. Considering hypothetically speaking, that we're talking about Pfizer. So ganun po yun.
Okay, so maraming salamat po talaga, Doc Germaline. So that is why nga din po talaga, Doc, even though we are vaccinated, we still have to follow the minimum health standards set by the IATF, especially on the wearing of our mask. Okay, Doc, thank you so much po,
Thank you
Doc,
po.
for the
Thank you
time.
so much.
You are busy enough in the COVID-19 vaccination po, Doc, that is already ongoing tayo ngayon na vaccinated. Actually, we have our health personnel in the division of Zamboanga del Sur who are already fully vaccinated by today po. So, Doc Germaline, thank you so much po talaga, Doc.
Thank you. I'm sorry, I really had to leave.
Next time on
Next
our
meeting pa ako.
webinars. Thank you po.
Thank you so much.
Amen. So here goes po, ladies and gentlemen. We have already heard Dr. Germaline Punsalan po talking about vaccination or COVID vaccine. The COVID vaccine itself, how safe it is to be given to all of us Filipinos, especially to our DepEd personnel, so at least we could really achieve that what we call the herd immunity. Okay, so basically po, the DepEd personnel is considered to be the basic education frontliner. Sabi po ng IATF, we are one of the basic education frontliners po. And with that, the prioritization was adjusted from B1 priority group ang DepEd, nagiging A4 priority group na po tayo. So it means that we are being prioritized by the government to be given the COVID-19 vaccination. So that is why we are really here this morning to give you an understanding of the COVID-19 vaccines, because most likely malapit na po tayo mabibigyan ng vaccination for this COVID-19. So to talk more about this prioritization and the memorandum about this COVID-19 vaccination for our frontliners, or the basic education frontliners, we will have our next speaker for this morning. So she is our very own nurse in charge of the school health section of the Division of Zamboanga del Sur, the SBFP focal person, and a very proactive health personnel on the COVID-19 vaccination. She is herself vaccinated with Sinovac. Ladies and gentlemen, please help me welcome virtually our next speaker for this morning, Ma'am Amy Alonzo.
Maraming buhay. Bakit kailangang magpabakuna? Bakit nga ba vaccination? Ang pandemyang ito ay kumuha ng maraming buhay at patuloy pa nitong nilalagay sa peligro ang buhay ng nakakarami. Pinahina din nito ang ating ekonomiya at maraming Pilipino ang nawalan ng trabaho dahil dito. Sa pagkatuklas ng bakuna laban sa COVID-19, nagkaroon tayo ng oportunidad na malabanan ang pandemyang ito. Sa tulong ng mga bakuna, ay may iwasan natin ang sintomas ng impeksyon at posibleng maiwasan din ang malalang impeksyon at matigilan ang pagkalat nito. Gayunpaman, gaya ng iba pang mga bakunang ginagamit sa nagdaang dekada, ang abilidad nitong protektahan ang ating komunidad ay tataas lamang kung hindi bababa sa 70% ng ating populasyon ay bakunado. Halimbawa, kung ang iyong barangay ay mayroong 100,000 katao, hindi dapat bumaba sa 70,000 ang dapat mabakunahan upang matiyak na proteksyon ang buong komunidad. Kaya ating tandaan, ang pagbabakuna ay hindi lamang para sa iyo o sa iyong pamilya. Ito ay para din sa iyong barangay, lungsod at probinsya. Aling mga bakuna ang gagamitin sa Pilipinas? Sa ngayon, may limitadong supply ng bakuna sa buong mundo. Sa katunayan, halos 80% ng stock sa buong mundo ay nabili na ng mga mayayamang bansa. Dahil dito, walang iisang kumpanya ang maaaring mag-supply ng 110 million na bakuna sa Pilipinas, kaya naman nakikipag-usap ang ating gobyerno sa 7 manufacturers. Sinisiguro natin na ang mga bakuna nito ay makakatanggap ng Emergency Use Authorization at kung may EUA sila, doon lamang sila bibilhin at gagamitin ng ating gobyerno para sa ating vaccination program. Nagbibigay ang EUA ng assurance o katiyakan na ang bakuna ay dumaan sa masusing pagsusuri at nirerekomenda ng mga independent na eksperto sa atin. Hindi mo rin kailangan mag-alala. Ang bakuna laban sa COVID-19 ay hindi magbibigay sa'yo ng COVID na sakit. Magkano ang babayaran ko para mabakunahan? Ibibigay ng gobyerno ang bakuna ng libre. Wala kang dapat bayaran para magpabakuna. Sino ang unang makakapagpabakuna? Dahil kailangan nating masiguradong patuloy na makakapagtrabaho ang ating health system para maalagaan tayo, ang mga medical frontliners ang unang makakatanggap ng bakuna. Susunod dito ay mga eligible na senior citizens dahil sila ay nasa greatest risk ng severe infection o kamatayan. Alam natin ito dahil sa ating lokal na datos na mas mapanganib ang COVID-19 sa mga matatanda. Ang pagkakasunod-sunod na kung sino ang unang makakatanggap ng bakuna ay natukoy sa tulong ng mga eksperto. Kailan at saan ka dapat magpabakuna? Ang inyong national government ay nakikipag-ugnayan sa mga lokal na pamahalaan upang maihatid ang bakuna sa inyo. Ang lokal na pamahalaan or LGU nyo ang maghahanda ng pagpaparehistro at pag-ayos ng schedule ninyo sa pagpapabakuna. Mangyaring abangan ang anunsyo at instructions na magmumula sa inyong mga mayor or governors ukol dito. Ano ang kailangan mo bago magpabakuna? Habang hinihintay natin ang pagdating ng mga bakuna, kumuha lamang ng impormasyon sa mga mapagkakatiwalaang sources. Magtanong lamang sa mga licensed medical professionals ukol sa wastong pagbabakuna para sa COVID-19. Matuto rin tayong mag-verify ng ating mga nababasa o naririnig. Tanging tamang impormasyon lamang ang makakapaggabay sa atin sa ating desisyon na magpabakuna. Ang inyong health history ay mahalaga din sa pagtukoy kung dapat ka bang bakunahan o hindi, kung anong bakuna o angkop sa iyo. Kaya naman, importanteng seryosohin natin ang health screening na ito. Magpakita sa araw ng inyong screening at ideklara ang inyong complete health history, gaya ng allergies o mga risk factors o mga sakit noon. Masusuri ka lamang ng tama ng isang health professional kung ibibigay mo ang mga hinihiling na impormasyon. Kung hindi ka naman sumailalim sa screening, hindi ka maaaring i-book o i-schedule para sa pagpapabakuna. Ano ang kailangang gawin sa araw ng pagbabakuna? Pumunta kayo sa vaccination site kung saan ka nakalista. Huwag kalimutan magsuot ng face mask at face shield. Bago ka turukan ng bakuna, kailangan mong pumirma ng isang informed consent. Sa pagpirma ng dokumentong ito, ay pinapatunayan mo na voluntaryo kang magpapabakuna at alam mo ang mga benepisyo at posibleng side effects nito. Huwag din kalimutan ang mga minimum public health standards habang nasa vaccination site. Katulad lamang ng pag-maintain ng 1 metrong layo sa iba at pagsasanitize ng inyong kamay habang naghihintay. Pagkatapos mong mabakunahan, ay makakatanggap ka ng isang vaccination card at malilista dito kung kailan ka nabakunahan at kung kailan ang iyong susunod na appointment. Mananatili ka muna sa vaccination site ng 1 oras upang obserbahan ka sa mga di pangkaraniwang na sintomas o adverse events. At dahil importante sa amin ang inyong kaligtasan, ay patuloy kang babantayan sa susunod na 1 taon or 12 months. Ano ang dapat gawin pagkatapos magpabakuna? Maaari kang makaranas ng side effects tulad ng sa trangkaso, pero mawawala naman ito dapat pagkatapos ng ilang araw. Huwag mag-alala, senyales to na bumubuo ng proteksyon laban sa sakit ang katawan mo. Karamihan nakakaranas ng lagnat o sakit at normal ito. Kontakin ang iyong healthcare provider kung ang pamumula o pagiging sensitibo ng lugar kung saan ka tinurukan ay lumala pagkatapos ng 24 na oras. At kung nag-aalala ka pa sa iyong mga sintomas o kung hindi sila nawawala pagkatapos ng ilang araw. Importanteng may ulat mo ang mga ito sa health authorities para maaral ng mga eksperto kung konektado nga ba ang mga sintomas mo sa bakuna o hindi. Ayaw naming mag-alala ang publiko ng hindi kinakailangan. Sa mga bakuna na meron tayo ngayon, ay kinakailangan ang 2 turok ng bakuna upang mabigyan ka ng inaasam na proteksyon. Kailangang magpaturok ka pa rin ng pangalawang bakuna kahit nagkaroon ka ng side effects. Maliban na lamang kung pinayuhan ka ng iyong healthcare provider na ipagpaliban ito. Paano ko patuloy na maproprotektahan ang sarili ko at ang aking pamilya? Gaya ng ibang pagbabakuna, nangailangan pa rin ng oras para sa iyong katawan na bumuo ng proteksyon sa COVID-19. Pero tandaan, ang pagbabakuna ay isa lamang sa maraming mga solusyon laban sa pandemya. Kailangan pa rin natin magpatuloy sa pagsuot ng mga face mask, pagsunod sa 1 meter physical distancing, pag-iwas sa mga kumpulan, at madalas na paghugas ng kamay upang maprotektahan ang inyong sarili at ang inyong pamilya. Paano natin masisiguro na ang ibabakuna sa atin ay tunay at mabisa? Ang mga bakuna ay biological products at sensitibo ang mga ito. Maari lang itong magbigay ng proteksyon sa atin kung sila ay authentic o galing sa totoong manufacturer at kung sila ay naita-transport o nahahatid mula factory hanggang vaccination site sa tamang temperatura. Hindi pwedeng masyadong mainit o masyadong malamig. Kung hindi, pwedeng masira ang bakuna at hindi na ito magiging epektibo. Bagkus, pwede pa itong makasama sa ating kalusugan. Kaya naman, siguraduhin natin na ang bakunang iyong matatanggap ay nagmula sa lehitimong manufacturers at naihatid sa tamang temperatura.
Tara, sa Vida Vaccination!
Good morning, everyone, especially to our SDS, Ma'am Harani and Jacinto, our 2 equally proactive ESDS, Sir Daligdig and Sir Salvador, our CID Chief, Ma'am Juliet Magallanes, and of course, our SGOD Chief, Sir Ernesto F. Tardo, and to all teaching and non-teaching personnel in the Division of Zamboanga del Sur, once again, good morning. Mga ma'am at sir, kayo po ang bida sa pandemya ngayon. So, as per Division Memorandum Number 55, Series of 2020, all schools are enjoined to fully adopt the BIDA Solution Plus sa COVID-19. We have here ang meaning po ng BIDA. Letter B, bawal ang walang mask at face shield. I, isanitize ang ating mga kamay. D, dumistansya ng at least 1 meter. At A, alamin ang totoong impormasyon. At plus, suportahan ang FDA-approved na bakuna. DepEd released a DTFC or the DepEd Task Force COVID-19 Memorandum Number 372, which is called the Guidance on COVID-19 Vaccination for DepEd teaching and non-teaching personnel. Health authorities, including the DOH, have repeatedly emphasized that COVID-19 vaccination is one of the major strategies to complement the existing measures and practices to mitigate the spread and reduce morbidity and mortality due to coronavirus infection. The government's direction pertaining to COVID-19 vaccination are laid out in the Philippine National Deployment and Vaccination Plan, or the NDVP, and further elaborated in DOH issuances. So, we have 3 participation. DepEd personnel have 3 levels of participation in the ongoing implementation of the NDVP. First, as recipients or beneficiaries. So a while ago, Dr. Punsalan has discussed about the vaccine itself and how it is being used, what are the after effects,
And this vaccine are naka-EUA po sila. This is to ensure safety and efficacy of the vaccines, yung tinatawag nating EUA, because only vaccines which are granted EUA will be purchased. This is a mechanism to facilitate the availability and the use of medical countermeasures, including vaccines during public health emergencies such as the current COVID-19 pandemic. Kaya po may mga iba't ibang brand ng vaccines tayo ngayon. So ang importante po dito is what is available. So go na tayo, no? So tayo, DepEd personnel as recipient or beneficiaries. Then, we also are members of the following bodies in the vaccination plan. We have task force and sub-task force groups of the immunization program. And we also are part of the vaccination team. And lastly, members of the Vaccination Operations Center. And teaching and non-teaching personnel of DepEd are also champions for advocacy on vaccination. Kasi dito po nanggagaling ang mga true information, hindi mga misinformation. So we are advocates of truth. So as recipients or beneficiaries, the vaccination remains to be the personal and voluntary decision of every personnel. Hindi po kayo pinipilit. We have to inform you and you have to make a decision for your own. So here it's now, nandito na yung vaccine, so we might as well grab the opportunity, di ba? So number one, as recipients or beneficiaries, DepEd personnel who wish to be vaccinated are advised to register for free vaccination through their respective LGUs. Because itong LGUs are the lead in the master listing of general population and profiling of health status. In this regard, DepEd personnel who wish to be vaccinated are reminded to keep themselves updated about the announcements and promptly respond to calls of the respective LGUs for both registration and the actual vaccination whenever they are eligible. So, LGU will inform you through the RHU na schedule na ninyo pa ang vaccination either sa RHU or in a designated place. Number two, DepEd personnel are advised to take note of which priority population group they belong to and to register accordingly. So we have here the priority population groups. So we have heard so much that it has been changed, yung mga priority groups natin. We have phase 1, priority eligible A. Bakit tinatawag nating priority? Because we have, according to the risk of exposure siya, no? So IATF, for the management of emerging infectious diseases, have identified frontline personnel in basic education and higher education institutions and agencies as part of the priority group A4. So going back to that slide, A1, we have frontline workers in health facilities. So those health workers working in the public and private clinics, hospitals. So nasa A1 po sila. Yung A2, that belongs to the senior citizens or those who are 60 years old and above. Na A3, adults with comorbidities, which I will later discuss. And A4, nandito yung frontline personnel, including education frontliners and uniform personnel. And A5 is the poor population. So, according to Secretary Leonor M. Briones submitted an appeal to IATF that is included in the IATF resolution number 110 series 2021, which adjusted from the target group from B1 to A4. Yung tayo po nasa health, nasa education, DepEd, we already belong to the A4. So, I would like to summarize yung A4.1 to 10. These are the frontline essential workers, no? Nandiyan yan sila. And I would like to discuss more on the A4.1, frontline personnel in basic education and higher education institutions. So dyan po tayo na belong, no? A4.1. And A4.12 is the are the OFWs, government frontline workers, sa nasa DFA, DPWH. So na-change ang priority, ang listing po ng mga groups. So the next slide is the old grouping. So sana nasa B1 na sana yung mga teachers, no? Teachers and social workers. But all these, the following slides is already old. So there was a resolution already by the IATF that ang health education will be frontliners ng mga teaching and non-teaching personnel will be A4.11. Yung phase 3, the rest of the Filipino population not otherwise included in the above groups. If the personnel fits the criteria for higher priority groups, yung A1 to 3, they do not wait for rollout for the later priority groups. Example, na belong po kayo sa A1 or A3, you do not have to wait, no? So grab the opportunity, and DepEd school health personnel who belong to priority group A1, pwede na kayong magpalis because we still have some personnel who have not been vaccinated. DepEd school health personnel, na-emphasize po dyan, who fits the A2 requirement of 60 years old and above, also have the option to register ahead of the teaching and non-teaching group. So may mga personnel po tayo na senior citizen na sila. So nasa A2 na yata sila, no? A2. Then, DepEd school health personnel who fits the requirements for A3 prioritization may register early so that they will be promptly given immunizations subject to availability of vaccine supplies. So yung supplies natin galing sa DOH from the central office down to the different regions. So we will be waiting. So depende po kung available na yung supplies so that we can avail of it. So a while ago, I was talking about the priority groups, yung may mga comorbidities. So what is comorbidity ba? Comorbidity is the presence of 2 or more diseases or medical conditions in a patient. So example of this, we have chronic respiratory disease and infections such as asthma, respiratory allergies, PTB, and bronchitis. And we also have cardiovascular disease like hypertension and coronary heart diseases, yung mga may mataas na cholesterol level, no? Rheumatic heart disease, and etc. Then we have the chronic kidney disease, cerebrovascular diseases, yung mga na-stroke na or transient ischemic attack, cancer or malignancy, diabetes mellitus type 1 and 2, obesity. Then we have neurologic diseases, dementia, Alzheimer's disease, Parkinson's disease, epilepsy, seizures, Bell's palsy. Then we also have chronic liver disease, hepatitis, cirrhosis, or non-alcoholic fatty liver disease. Immunodeficiency state, that is the prolonged use of corticosteroids, because prolonged use of these steroids, bababa po yung immunity mo, no? And HIV infection, and other diseases such as sickle cell disease, thalassemia yung mga blood disorders natin, yung mababa yung hemoglobin, or the Down syndrome, and the Down syndrome. DepEd personnel who fit the criteria for priority A5 may also register as soon as possible. So it is important to register in one's respective LGU of place of residence or work. So whichever yung madali o faster, doon tayo, no? So another, DepEd personnel are enjoined to keep themselves updated about the latest guidelines from DOH about vaccination, especially on eligibility, deferment, and the requirements for medical clearance and certification, among others. So if you have comorbidities, you can attach medical clearance coming from your doctors to prove to you that to prove to the RHU personnel that you are okay to be vaccinated. And then DOH issuances, including updates, can be accessed at that link as shown. DepEd personnel are also instructed to keep a record of their vaccination details for future reporting within DepEd. You have to keep that one. Then, There is an official platform for master listing and pre-registration of individuals for COVID-19 vaccination. Ito yung COVID-19 Vaccine Information Management System Immunization Registry. This is in coordination with our MNE coordinator, Sir Jong, and the ICT. So may platform na gagawin. We will later issue a memo in effect to that. DepEd is coordinating with concerned agencies to have its own database of vaccination. So, mga vaccination-related data sa subsequent issuances na po siya. DepEd personnel are reminded to strictly observe the required health standards before, during, and even after vaccination. Hindi po ibig sabihin na nabakunahan na kayo, you are already safe. As what Dr. Punsalan has explained a while ago, you should still practice the minimum health standards even before, during, and after vaccination. DepEd personnel are also assured by DOH that any adverse event following immunization or the AEFI shall be properly managed po. So if ever may mga side effects or adverse event, AEFI, RHU personnel are always there and on standby during the immunization period so that they can cater to what is, kung may mga emergency po kayo, may mga reactions kayo. Then, a while ago, pinakita na ito ni Dr. Punsalan. So, that's how it looks like if you will be vaccinated. There is a registration area. Then, i-screen po kayo before kayo babakunahan. And you are to be monitored after 30 minutes. A total of 1 hour per person. Pero pag walang problema, diretso na yan, no? Okay. So, there is a form, a personal data form, which an individual will accomplish. As of the moment, the health personnel of DepEd Division of Zamboanga del Sur have already had their first dose. And we already accomplished this form, the personal data form, wherein they need your name, contact number, civil status, and most importantly, yung PhilHealth ID natin. That should be indicated in the form and the type of ID you are using. Preferably yung PRC card ninyo. Okay lang kahit expired na siya pero bawal sa amin as medical professionals. Kailangan yung PRC card namin is new and renewed. Then there is a questionnaire there, may checklist if you have this, allergies to some medications, you have to check those items. And the form presented on the left side is to be filled up by the medical or the RH personnel, health personnel, and then on the right side, that will be your COVID-19 vaccination card. Please, huwag niyo pong walain yung card na yan. That will be your evidence when you will have your second dose of vaccination. Iba-iba po yung schedule ng Sinovac vaccine and AstraZeneca. Yun lang po yung available sa atin ngayon. So, most of us received the Sinovac vaccine. So, with this, may mga photos po tayo ng mga school health personnel who have been vaccinated. We have all our dentists have been vaccinated, Dr. Ramanzo, and all the nurses. Nurses po, no? From the different districts have been vaccinated also. And so far naman, we have, some of them have, may counting reaction lang. Like for me, palagi akong gutom, and then, I'm always sleepy. So different people react differently to the vaccine. So those are the photos to show you that we are okay and we have been vaccinated against COVID-19. And kaya tayo na, tara na at maging bida. Maraming salamat po.
Okay, so thank you so much, Ma'am Aimee, no, for that very comprehensive discussion about the prioritization and how we can give the prioritization to our DepEd personnel who will be given vaccination for this time. So, Ma'am Aimee, we still have a lot of questions coming from our live viewers from this morning. So these are the few of the questions that we have seen in our chat box. So first question, Ma'am Aimee, will our children be at high risk if I and my husband will be vaccinated? We are both DepEd employee at ang mga anak namin ay nasa edad 21 ang eldest, 21 ang eldest, the 3 is the youngest. Pwede po bang for a while? Okay, hindi ko na masyadong makita yung last portion ng question, but will be their children at least if they are already vaccinated, both of them?
Getting vaccinated, it does, may pina-follow po tayong doses. We have the first dose and second dose. To achieve its maximum potency, we have to complete the second dose of the COVID vaccine. So yung question, Kweng, what was that?
Kung vaccinated na po silang dalawa, Ma'am Aimee, both the husband and the wife for DepEd employees, nagiging vaccinated na daw sila, may risk ba daw na maidadala sa kanilang mga anak na hindi vaccinated?
For those children, di ba may mga target groups tayo, 16 years old below, hindi pa sila kasali sa vaccination program. They will be catered later on in the future pag marami na tayong vaccine supplies. So, for the parents na vaccinated na sila, if complete na yung doses up to 1 year na yung protection nila to achieve its efficacy, yung mga anak nila are at risk, especially pag lalabas sila. Hindi po ba bawal ang lalabas ang mga bata? And then, having parents being vaccinated, that means at least na-attain na yung herd immunity within the family only. A while ago, na-explain ni Doktora yung herd immunity, in which kung na-vaccinate na kayo, yung wala pa na-vaccinate, if ever exposed sila sa COVID-19 virus, sila po yung daling they can have that infection if ever they are not practicing these minimum health standards.
Okay, so thank you so much, Ma'am Aimee, no? So to add on na siguro, no, there are still no studies pa naman din po saying that once a person is vaccinated, yung mga kasamahan niya pwede nang maging at risk. Wala pa naman po ganyang mga researches. But at least you in your family or dili na mo kanang mahadlok ba na magiging carriers. Okay, you have been vaccinated already. Though you can still be, but of a lower risk na lang po tayo, di ba? If we are already vaccinated. So we have another question here. Can a vaccinated person still be a carrier of the virus?
As what I have said ago, you have to complete the doses. And may mga news po tayo na nakuha na those who have been vaccinated are still inflicted with the disease. It's because yung immune system nila is still working on the vaccine. And I think Dr. Punsalan has explained a while ago on how the vaccine works, and para po protected tayo, so we have to be vaccinated. That's why this information drive has been given, especially to DepEd teaching and non-teaching personnel, for you to be oriented on the vaccine itself and to help you be protected.
Okay. So another question po, Ma'am Aimee. This is coming from Pitogo Central Elementary School. Hindi po ba daw makasasama sa kalusugan kung magpa-vaccine na umiinom po ako ng medicine na Euthyrox?
I think Euthyrox is for hyperthyroidism.
Yes, I guess that
so,
is.
I have explained a while ago for the comorbidities, yung may mga patients na they are having 2 or more diseases. So that's why kung malala if ever pa parang serious gamay yung sakit nyo, no? You have to attach a medical certificate. You have to ask your doctor that you have been cleared and you are okay to have the vaccine. So it does not matter actually if nag-maintain lang kayo. In fact, even those who are comorbid, taas po ang risk nila to have to get infected. So the more they need the vaccine itself.
Correct po, Ma'am Aimee. So nakikita natin, no, even now in the news that more of the persons who are inflicted with COVID-19, especially those who have comorbidities, mataas talaga ang chance na naging severe ang reaction nito sa kanilang kalusugan. Okay? So another question, it talks about yung may asthma, pwede pa din ba daw bakunahan?
If you have asthma or that's a respiratory disease, no? So number 1 yun sa comorbid natin. If you have asthma attack during the vaccination, of course, i-deferred muna natin yan. You have to take your medicines first because mga asthmatic patients, they have maintenance meds. Meron tayong mga salbutamol, etc. Or yung mga allergic rhinitis, you have to take your own meds muna, yung mga cetirizine. Pero, huwag mag-inom muna ng gamot na hindi pa nabakunahan because you are anticipating that you will have that reaction or effect kahit hindi ka pa nabakunahan. So when it comes to vaccination program, especially yung ibang asthmatic patients, baka nervous na sila, natatakot na sila, so nag-asthma attack sila. So, if you have medicine on hand, you take it as soon as possible and you will be monitored on the vaccination site. Hindi po kayo bibigyan pag may atake kayo. You have to be stabilized muna. I-stabilize muna yung condition ninyo prior to the vaccination.
Okay, so that's true po, no, Ma'am Aimee, because actually, guys, for the information of everybody, my parents have already been vaccinated also just last Monday. And both of them are asthmatic. Pero during the time that they are given vaccination, they were assessed by the doctor first. And during that time, wala po silang, wala silang nararamdaman at that time. So they were been given the vaccination. And thank God, they are really safe and parang maganda naman din. May mga konting reaction lang like ginugutom kasi yun din yung mga reaction natin,
yes,
di ba, Ma'am Aimee? So those are just side effects or mild side effects and we do not have to worry because our RHU or our city health officers are really there to assess us and even doctors are really there to assess us during the vaccination. Hindi po tayo pababayaan lang po nagbibigyan ng vaccination. There would really be a thorough assessment coming from doctors who are there during the vaccination. So, kapag mga may history of asthma, but as long as wala kayong attack at that time, even hypertension, yung father ko nga at that time is 180 over 90 ang BP niya at that time. Siguro because of anxiety. But after a while, as the doctor assessed him, naging 160 over 80. So binigyan na siya agad ng COVID-19 vaccine, which is the Sinovac. And fortunately, after post-vaccination, naging 140 over 80 lang naman din ang BP ng father ko. So I guess it's really safe po. It's really safe po talaga. So we are a living confidant because we have been vaccinated. So we are here in front of you. So meaning, safe po yung vaccination natin. So next up, another question coming from Suminot National High School. When will be the scheduled vaccinations for the DepEd personnel? Do we have a concrete schedule na po ba talaga na kailan talaga yung sa atin sa DepEd?
I think as what I have discussed a while ago, you have to visit your LGU or the RHU. Nandun po yung schedule nila kung when ang schedule ng DepEd personnel. Because here in the division office, we will be working on that sooner kasi we belong here sa city. And just visit your LGUs to have that information yung sa scheduling po natin. And before that day, you have to prepare yourself. This is a piece of advice coming from me, no? Mind over matter really works, no? huwag kayong matakot. Malakas po yung mental health natin. Dapat you have to think positively. You have to be assertive enough because vaccines are available. Grab the opportunity. Although may mga anxieties tayo, may mga konting anxieties, it's normal. It's normal, no? Before, kahit ako, meron akong ganon. Even me, no? Kahit health personnel ako. But through working with my mind, mental health, bumaba din later yung blood pressure ko.
Okay, so thank you, Ma'am Imes, no? So yun nga, with the scheduling also, I guess they can coordinate with their district nurses because their district nurses are being called up by their RHU as to when they will have the master listing of our teachers and non-teaching personnel in DepEd. So we will be later on, I guess we'll be later on being called up by the RHU, so we will do the master listing. But for now, as of now, I guess the municipalities are already on the A2 priority. So nasa A2 priority pa po tayo. It means the senior citizens are the one that are given already the COVID-19 vaccination. But if we have teachers who are already 60 years old and above, I guess they can do that. They can go already to their RHU, or you can ask your school health personnel or your district nurse to coordinate with you for the vaccination. And then as of now, we will be also doing, the school health personnel will also be doing master of profiling of our teachers. So sa profiling po, dito lang sa DepEd, your district nurses will be assessing you kung ano-ano yung mga, if you have any comorbidities, your age, and then other things that you have to be assessed so that we could give you also a schedule as to when we can do the vaccination. Pero as of now, wala pa po talagang complete na schedule kung kailan tayo.
In addition to that, I am assigned in Aurora West District. We have just submitted our data forms, personal data forms. Yun po yung profiling natin to RHU. Kasi doon nila makikita kung how many are the teaching and non-teaching personnel of this district, kung meron ba silang mga comorbidities. You have to submit that profiling, that master listing to the RHU so that they will know kung ilan ang bibigyan or yung ayaw na they don't want to be vaccinated. So, yung vaccines kasi, yung supplies, kinakount yan nila kung ilan ang i-open nila so they can cater to at least 10, depende kung anong vaccine na available. So there was a part there kung yung taong nakalist is absent siya or ayaw niya, pero that slot is for her or him, meron po tayong standby. Kaya yung mga nurses natin, mga buffer sila. Kaya yung mga nurses natin, kahit hindi pa schedule nila, na nag-standby po sila. So, they were accommodated. Kung standby kayo, meron pang isa kasi nag-back out yung si Pedro. So, si Juana, ipuli si Juana diri. So that they can, she can get the slot, no, that is being offered by the RHU facility.
Okay, so yun po, no? So we have other questions. I hope you really have enlightened your minds about these questions that you have with us right now. There are still other questions like, what are the vaccines that are going to be used for DepEd? Ano nga ba yung vaccine na gagamitin for DepEd?
What we have right now are, marami po tayong Sinovac. Hindi po tayo, hindi naman yun sa akin. Sa DOH po yun galing. So, most likely, hindi lang ako sure, no? Pero parang Sinovac na rin ang ilalabas nila. Kasi yung AstraZeneca, konti lang yata ang dumating. So, Sinovac, okay naman siya.
Okay. Yes, Ma'am Ice, but we do not still know what will be the concrete, ano yung talaga yung gagamitin during that time, because as for the RHU or the DOH, they will always tell us that whatever vaccine is available, yun po ang ibibigay at the moment. Yung anong available po talaga na vaccine. But most likely, yung maraming vaccine na meron tayo sa Pilipinas is the Sinovac. And we only have 2 vaccines na given pa ata, no? Yung Sinovac and the AstraZeneca. And parang okay naman talaga po siya for us now because we have been already vaccinated. Okay? So how many times are we going to get vaccinated?
You will receive 2 doses. There is an interval. Depende po kung anong vaccine na receive ninyo. So like us, we have after the first dose, you have to wait for 28 days. And kami po, that will be on next week, May 11 yata, yung second dose namin. So after 28 days. Unlike AstraZeneca, iba po yung interval nila. So you have to follow what is being required from you. RHU personnel will inform you na ma'am, you will have your second dose on Monday or Tuesday. And they will inform you ahead of time.
Okay. So there are also still questions no regarding parang same lang na mga questions about like having fatty liver, crystal stones, mga sugar mga allergies, ano pa yung ditong iba ano pa yung mga different cardiac arrhythmias, pwede ba daw bigyan ng vaccination? Same as lang sinabi kanina ni Ma'am Aimee, pwede po tayo magbigay ng vaccination ng COVID-19 kahit po meron tayong mga comorbidities. As long as at the time that we will be given the vaccine upon assessment, wala tayong nararamdaman po. Okay? So, hindi ko na iisahin yung mga questions, but yun lang as to sum up everything about sa mga comorbidities. So, pwede po as long as during assessment, during the day of vaccination, wala tayong nararamdaman.
So, kailangan po siya controlled yung comorbidities ninyo. Dapat may mga maintenance kayo. You have to comply what is being required of you by your doctors, no? Kailangan susundin ninyo ang reseta. Hindi wala akong pera ngayon, bukas na lang or next week na lang or hindi. Kailangan maintenance. Kaya nga siya tinatawag na maintenance. You have to take it religiously as prescribed by your doctors. So dapat controlled po yung mga comorbidities natin before you will receive, or you can have a medical certificate certifying there by your doctor that you are okay to have that vaccine.
So I will be also reading this message, no, and luckily, Dr. Jem also gave us the answer for this question that we have from our live viewers. What if the vaccine developed a blood clot after having it? Ano po daw ang ikakagarantiya ng health sector na if ever mangyari ito sa isang nabakunahan? So yun po yung question. So sabi naman po ni Doc Punsalan, Gemaline, covered po sila sa COVID Vaccination Act should they develop any adverse effect after immunization. If admitted sila sa DOH retained hospital, wala na po silang babayaran. But so far, as of this moment, we haven't heard any concrete evidence that there is a adverse effect that happened after vaccination. Wala pa po tayong mga concrete evidences na meron talagang nagkaka-adverse effect kagaya ng ganon dito sa Pilipinas. Okay? Even nga in the different countries, hindi pa siya ganon ka concrete yung study nila. Parang haka-haka pa lang. They did not see any link to the vaccination. So, kagaya kanina, no? Because we can really see a lot of news, a lot of videos coming out in the Facebook, but we do not know how legit it is. So later on, we will also be discussing about infodemic. So that will be discussed by our next speaker later on. So I guess yun na lang muna yung i-cater natin ng mga question, no, for this moment. Ito lang, one question lang. If the teacher will refuse to be vaccinated, meron po ba daw mga sanctions about it?
I have discussed in one of my slides, getting vaccinated is personal and voluntary po siya. Kaya po siya voluntary because you have to get the right information first. You have to have an informed choice. Gaya ng ganito, we are doing this to let you inform what is COVID-19 vaccine, what are to be done, what you should prepare yourself, no? So you have to know the facts not the myths. So later on, i-discuss ng next speaker yung mga facts natin about COVID-19 vaccine. And then, yun na nga.
Okay, so daghang salamat kay Ma'am Amy no for sharing your knowledge about this memorandum and about the vaccination of COVID-19. So I guess, guys, I hope we really have given the answers to your queries and questions for this morning, no? But later on, we still have to continue our question and answer portion. Oh my God. As we go on with the next topic for this morning. So thank you so much, Ma'am Amy
Thank you,
Alonso, for
Quang.
gracing this day. And we will move on to our next speaker for this morning, she will be talking about infodemic, choosing the right information. So please help me welcome our information officer in the Department of Education Division of Zamboanga del Sur, the very sexy, kagaya ko po, Char, Miss Therese Angelica Mache. Take it away, Ma'am Therese.
So magandang umaga po sa ating mga viewers, and it's such an honor to be here to talk about infodemic, choosing the right information in the time of pandemic. So like what the other speaker has said a while ago, ang dami ng mga haka-haka na naririnig natin during the development and during the actual vaccination process ng ating bansa, di ba? Pero totoo nga ba ito? Ito yung mga bagay na dapat tignan natin ngayon. So, first, what do we have to know? Context matters. We are all humans and therefore we are biased. We all have our biases, and this stems from a lot of factors. Number one dito, saan ba tayong mga impormasyon exposed? Ikalawa, sino-sino ba ang mga taong nakakausap natin? Ito biases na natin to, di ba? Because we have preference on where to get our information and the people that we want to believe. One another problem sa atin ngayon when getting information is that many of us do not know how to ask the right questions, and many of us do not know how to give the right answers. For example, kumain ka na? Busog pa ako. Nandyan ba nanay mo? Bakit po? Anong oras na? Maaga pa. Paano mo ginawa yan? Madali lang. These are certain questions na pwede naman sana nating bigyan ng direct answers, pero hindi natin ginagawa. And this is the source, and this is the start of wrong information. Asking the right question is a talent. And this is especially from or available to our scientists and to teachers. Kaya nga, napaka-importante na andito sila dahil sila ang mga credible people where we can get our information. Sabi nga ni Dr. Castillo, the desperate need of millions of people in developing countries should be enough incentive for a research worker to do much effective experimentation designed to alleviate their condition. This is why it's important for us to have scientists and teachers because they will be the ones, primary people, to do the research para sa mga bagay-bagay na hindi natin alam, sila ang pwede nating tanungin at sila ang magbibigay ng tamang sagot sa ating mga confusions at ang ating mga tanong. So in the act of research, we have science, equity, and ethics. These are the important principles that we have to see for us to have the right information. Sa DepEd, ang data natin as of March 2020, we have 4,468 COVID-19 positive records among learners and personnel. At the moment though, we already have 7,000 plus na mga learners and mga teachers or DepEd personnel na mayroong positive cases na ng COVID-19. So the number is still increasing because, and one reason for that is that hindi tayo nakakakuha or hindi tayo kumukuha ng tamang impormasyon. Next is evaluating health information. So like what we have been saying a while ago, we are getting a lot of information from different sources. So what do we have to do? In reviewing information, use your judgment, recognizing that evaluating is something of an art. Hindi dapat tayo tanggap ng impormasyon, dapat marunong tayong mag-assess, marunong tayong mag-evaluate. Sabi nga nila, in the time of pandemic, we also have an infodemic. Meaning, ang dami-dami na nating natatanggap na impormasyon, hindi naman tayo sigurado kung tama ba o mali. The information landscape during a pandemic can be compared to that of a large bushfire. There are high levels of uncertainty and risk coupled with large volumes of information. In both scenarios, individuals rely on affiliated and geographical groups for important notices, such as community and postcode groups such as Facebook, di ba? And because of that, because of our preferred geographical scenarios, because of our preferred environments, we are getting a lot of misinformation, disinformation, underinformation, and actually very few na tamang impormasyon. Information, these are things that are accurate to the best of our current knowledge. But, ano nga ba ang misinformation or misinformation? Misinformation is the incorrect or misleading information. But this does not have any intention of hurting other people. Pero dito naman, merong disinformation. And disinformation is the deliberate act of spreading wrong information to mislead and cause hurt to other people. Remember guys, sa infodemic, there is overabundance of information and some of these are accurate and some are not. That occurs during sa mga tulad ng panahon natin ngayon ng pandemya. And this can lead to confusion and ultimate mistrust to government and public health response. For example, natin ngayon, di ba, ang dami-dami natin naririnig na kinokos na hindi daw totoo ang COVID-19. Gawa-gawa lang daw ito para maka-raise ng funding, para makakuha ng kwarta, para mag-divert ng funding natin sa gobyerno. But we see a lot of cases in our environment. Pero meron pa rin mga taong naniniwala. So what do we do to combat against this infodemic? Number one is check for credibility and accuracy. May mga tanong tayong pwede nating tignan while we assess the information that we get, even if it's from Facebook. Number one, is the source credible? Ito yung pinaka-importanting tanong. Is the source credible? Sino ba ang publisher nito? Sino ba ang sumulat nito? Ano ba ang mga credentials na sumulat nito? Diba? Credential is very important. even among the medical society, they have the various focuses ng kanilang studies. Meron silang kanilang mga focus ng kanilang studies, diba? Meron silang mga ginawang mga pag-aaral para mas mapatindi at mapalalim pa ang kanilang kaalaman sa isang particular na bagay. Hindi porket doktor ka na, alam mo na ang lahat ng pwedeng mangyari sa isang katawan, alam mo na ang pwedeng lahat na solusyon sa mga sakit. So even if you got the information from a doctor, it is important for you to understand or to know whether the doctor is a credible source in that particular field. Epidemiologist ba siya? Virologist ba siya? Or is he for the heart or for the kidney? There are a lot of doctors out there. So hindi din yan dahil because doctor na sila na ang dapat mong paniwalaan. Dahil tayo lahat ay mga different na mga sources, tayo lahat ay may mga different researches and particular focus sa ating mga kaalaman. Another is, do the author have hidden agenda? And is the information peer-reviewed? That is what the research is all about. Hindi lang dahil nakagawa siya ng isang research, tama na ito, di ba? Lahat ito ay pinapasa pa sa mga grupo ng mga sa akademya para mapag-aralan kung tama din ba ang kanyang mga nakuhang result ng kanyang research. What are the clues that we can see to know if credible or accurate ba ang source ng ating impormasyon? For us, because of the information age that we are in, digital na tayo, most of us do not particularly hold a physical book now, but just do immediate research via Google and whatnot. These are the things that we can be assured of na tama yung impormasyon na pinagkukunan natin. If the website ends with, or the URL ends with edu, this means that it was published by an organization that is associated with an educational institution or a university. .gov belongs to the government organizations, .org if it belongs to a non-profit organization, and .com if it belongs for a for-profit company. So now we know how to assess our informations or the informations that you get from Facebook or different online sources. Ano naman yung mga dapat nating maging red flags or dapat nating bantayan kung mali ba or may misinformation or disinformation ba sa isang bagay na binabasa natin? Is the information accurate? Is the information based on scientific evidence? When the pandemic sprung up on us and we all had to go into lockdowns and all of that, community quarantines, one of the many things that we heard on how to solve the COVID-19 when you are affected with COVID-19 is that you eat banana. Diba? Ang daming, for a time, yung market natin na puno ng mga taong bumibili lahat ng all kinds of banana because somehow it came out na ito yung solusyon para hindi ka magka-COVID-19. Have you asked yourself when you read this information in Facebook, meron bang scientific evidence na ang banana talaga ang solusyon sa COVID-19? Another question you have to ask yourself, is the information supported by facts? Meron na ba tayong mga scientific evidence na nagsasabing tama ang impormasyon na ito? Is the original source listed? Or is the source anonymous? And do other sources back up the information? Meron bang ibang studies na nagsasabing, yes, this is an accurate information? Is the information current? Be skeptical of informations when you find these red flags. If the info is anonymous, there is a conflict of interest, info is one-sided or biased, info is outdated, there is a claim of a miracle or secret cure, no evidence is cited, and grammar is poor and words are misspelled. So these are just very, very basic red flags na pwede nating tignan para malaman natin kung dapat ba tayo maniwala sa isang impormasyon or hindi. These are just example, guys, of all the misinformations and disinformations that we have heard about COVID-19 and the vaccine itself. For the vaccine, will a COVID-19 vaccine alter my DNA? Ito yung mga first na lumabas na mga issue regarding getting a vaccination, di ba? Na pag daw naturukan na tayo ng COVID-19 vaccine, we could develop different genetic problems because nga it will destroy daw our DNA or will somehow make changes in our DNA. Sabi nga ni Dr. Punsalan kanina, the vaccine is a certain protein. But remember guys, ang alam lang naman kasi nating mga liman, di ba, is yung protein na kinakain natin. But guys, there are many kinds of protein, and COVID-19 vaccine is just one of it. And this will not, and this is already a proven fact by the CDC, that COVID-19 will not alter the DNA. It will not cause any changes in our DNA. It's just a different kind of protein that they have enhanced to help us be protected from the effects of the COVID-19. Second myth is that if I've already had COVID-19, I don't need a vaccine. Hindi ganun, guys. Remember that we are constantly getting news of people na kabago-bago pa lang na nagka-COVID-19 and was cured from it, not cured from it, but naka-recover from it, suddenly nagka-virus na naman sila. So guys, the vaccine as been explained constantly kanina nila Dr. Punsalan, nila Nurse Amy Alonzo, the COVID-19 vaccine is not an old cure to the virus. It will just help our body prevent it from getting the most severe effects of the virus. And because you've already had a COVID-19, this also does not mean na hindi ka na makakaroon ng COVID-19 in the future. So, another, researchers rush the development of the COVID-19 vaccine, so its effectiveness and safety cannot be trusted. I've heard this myth sa most of my friends, actually. Most of my friends has been telling me na they will not, a lot of my friends are telling me that they will not get the vaccine because it was rushed, minadali ang paggawa ng vaccine. But the truth is, when this has been discovered, that the COVID-19 problem has been discovered, a lot of the medical institutions has already started doing the studies, and because of the vast number of people affected by it, it was easier for them to get away of knowing kung ano ba yung consistency ng effect ng sakit and kung ano yung mga possible cures dito. So it was not rushed, guys. It actually went through all the necessary trials needed para makadevelop ng vaccine. It has constantly been compared to the vaccines that we already had before nga. Kesyo nga daw, masyadong matagal na develop ang ibang vaccine. Guys, you also have to remember that we are in a better times now, more modern times now, and we have more equipments and actually knowledge into developing vaccines. So, hindi ito minadali, guys. This was thoroughly studied, and this is thoroughly backed up by hard evidence that the vaccine is effective in terms of lessening the possible effects of COVID-19 on an individual. So yeah, these are data that you can see. Social media helped companies find and engage study volunteers, and many were willing to help with COVID-19 research. Vaccine programs had plenty of resources as governments invested in research and or paid for vaccines in advance. So yes, guys, it was thoroughly researched. It was fully funded, not just by one or two companies, but the entire world, because it is affecting the entire world. The search for information can be confusing. Yes, that is very understandable when you find credible sources of information. So what do? When conflicting information, you have or recommend different treatments, differences of opinions arise when there is no solid evidence. And what do? You may want to consult with different health professionals to decide what is best for you. So a while ago, we keep on getting questions on ano ba nga ba ang mangyayari kung may mga comorbidities tayo na nararanasan? Is it safe for us to get the vaccine? The most effective way for you to know is, of course, to approach a health professional, consult a health professional so that malalaman mo if dapat ka ba sa vaccine na ito or hindi. Do not rely on very vague information. Do not rely on just people who are not experts in this field. You have to consult a health professional. While it is a useful tool for researching health-related issues, the internet, guys, and I would like to emphasize this, the internet does not replace a discussion with a healthcare professional. Okay? Hindi po doktor ang Facebook, hindi po doktor ang Google. Meron po tayong mga professional na pwede natin kausapin so we can get the right information and specific to the kind of body and kind of health needs that we have. We have to approach a health professional. Now, to the immunization itself. Immunization is a key component of primary health care. It is an indisputable human right. Tayo po ay may mga karapatan sa isang safe at healthy na environment at kasama po dito ang pagiging immune sa mga klase-klaseng sakit, tulad na lamang po ng COVID-19. One of the best health investments money can buy is getting vaccines or getting vaccinated. Critical to the prevention and control of infectious disease outbreaks, and having or getting vaccinated is a global public good, especially in the time of pandemic. Kung ayaw nyo man po magpa-vaccine dahil po feeling nyo kaya naman po ng inyong katawan kung magkakasakit man kayo, isipin nyo na lang po na hindi po ito ginagawa para sa inyong sarili lamang, kundi para sa inyong mga anak, para sa inyong mga parents, para po sa inyong mga kaibigan at sa lahat ng taong pumapalibot po sa inyo. Vaccination is a global good. But we have to also emphasize, vaccines don't save lives. It is the vaccination itself. Kailangan po ang vaccine is maturok po sa ating katawan dahil ito po ang magiging paraan para makadevelop po tayo ng immunity or ng immunity sa mga sakit na ay sa mga dala nito mga effects sa ating katawan or at sa ibang tao na din po. So we need to get the vaccines from inside a vial to inside people. Vaccinations save lives. What are some of the key things we have to know? According to the Johns Hopkins University, COVID-19 vaccines are safe and effective. You may have side effects, yes po. Typical po na may mga side effects po tayong mararamdaman, though not to everybody because we have different body types. So iba-iba po ang mga posible nating ma-experience. Sama po sa sinabi kanina ni Nurse Amy, ni Nurse Kirsten, ang sa kanila po is gusto nilang kumain, di ba? Nagugutom po daw sila all the time. So that means na mas magiging sexy po pala tayo dito sa vaccines. Pero sa iba naman po, like with my brother, he's also a doctor, what he experienced was that a terrible headache. So these are just very, very typical na mga side effects ng vaccination. It typically takes 2 weeks after vaccination for the body to build protection or immunity against the virus that causes the COVID-19. You are not fully vaccinated until 2 weeks after the second dose of a 2-dose vaccine or 2 weeks after a 1-dose vaccine. COVID-19 vaccines are more widely accessible. Everyone 16 years and older is now eligible for a COVID-19 vaccination. And people who have been fully vaccinated can start to do some things that they had stopped doing because of the pandemic. But again, we would like to emphasize on the third thing that I said, that when you get a vaccine, on the day that you get a vaccine, this does not mean na you're automatically protected. Meron po tayong period na kailangang tignan, na kailangang i-observe. And even if you already have a vaccine, again, this does not mean na hindi na po kayo maapektuhan ng virus or makakakuha ng virus. You still have to ensure and be very, very strict in complying with minimum health protocols. So according to CAP of COVID, or Exploring Knowledge, Attitude, and Practicing for COVID-19 Prevention by the Johns Hopkins, here in the Philippines, the target is to get 75% of the population. However, a little over the 50% lamang po ang gustong magpa-vaccine. And this is because of the many misinformation and disinformation that we are getting from all around us. This is way below the target para makadevelop po tayo ng herd immunity. And we are actually doing this information to hopefully cure that problem, to hopefully address that problem and increase the number of people na gustong magpa-vaccinate. Because we need at least 75% of the population to get vaccinated to develop herd immunity. Sa study po na ginawa ng ating mga universities, according sa kanila, 31 and above, mostly ang mga gustong magpa-vaccinate, and these are people who has graduated from college or has a certain level of education po. Most of these people are also from urban areas, and most are males. So I think this is very understandable because women have a lot of mga confusions din, di ba? Meron tayong mas maraming dapat tignan sa ating katawan, especially if it involves wanting to get pregnant or mga ganon. But again, we can consult our health professionals so that we can change our perception of the vaccine and be convinced of the vaccine. Hindi po tama na nagfe-Facebook lang tayo. For us to be convinced, it's necessary for us to consult a health professional on the matter. Now, exposure and trust to information sources. According to a study, exposure to information sources, most of us get our information from online sources. And this is primarily Facebook. 84% po ng ating study population, ng ating mga respondents, ang kinukunan nila ng impormasyon ay Facebook. Next is television. Third lang po ang government health professional and WHO and local health workers and so on. Scientist is only at the 7th, di ba? So this is actually very telling on why we are getting very low numbers of people who wants to get vaccinated. Pero naman, in terms of trust, scientists din ang sinasabi ng ating respondents na pinagkakatiwalaan nilang source ng information. But there is a disparity between the two. Kasi sa Facebook naman or mga online sources, it is very hard to actually know whether or not the person telling us or giving us information is the right person to or the right professional to give that kind of information. And to both politicians ang ating pinaka-lowest sources of exposure and trust sa information regarding COVID-19. Selected highlights of online surveys, healthcare workers and general population. So according to this study, likely to be vaccinated, healthcare workers and general population. Why? Because they want to be protected and to prevent and to be immunized against COVID-19 and to keep themselves and their families safe. For those who say na not likely to be vaccinated, among healthcare workers, ang sinasabi nila is hindi pa ito thoroughly studied. Sa general population naman, safety concerns. And for those who say that not sure if they will be vaccinated, healthcare workers say that it's about safety concerns. And for the general information, they say that they don't have enough information. Now we move on to the state of being abnormal, our new state of being. A lot of us now call what we are at the moment a new normal. But according to Dr. Castillo, we should not be aiming into going back to the old normal, but building a better normal, a better new normal for us. We have to change so that we can build back towards a better everyday and not just go back to what we had before. Na may mga inequalities, may mga andami-daming problema. So the pandemic gives us a way of restarting everything and changing into a better tomorrow. Planetary imbalances and social imbalances reinforce themselves. So this is very clear now during the pandemic. Our sources of information, our access to health facilities, our access to everything, our supplies, our food, these are planetary and social imbalances that actually reinforces themselves and makes being in the time of pandemic equally or harder for more people and less effects to some people. And these are the kind of things that we can change. We have to change so that we can build a better tomorrow after this pandemic. Now, what are the challenges that health professionals and us generally are getting in this issue of vaccination? The magnitude of the coming vaccination effort. So ngayon, ang mga health professionals natin, and they're starting now with our senior citizens with comorbidities na binavaccinate na sila. But this is a very small chunk of our population pa lang. So ang dami-dami pang dapat gawin. And in this effort, it involves changing the misconceptions of people towards the vaccine. Vaccines are new and likely to be only partially effective for yet unknown period of time. So even if it's already developed, kailangan din na i-improve pa ito, pinag-aaralan pa ito. So-called adverse events may be rightly or incorrectly attributed to the new vaccine. So tulad ng mga tanong kanina, di ba, yung mga blood clots, yung mga nakikita natin sa internet na biglang hinihimatay or namatay na daw. These are the challenges that we have to change, that we have to overcome para mas maparami pa sa atin ang gustong maging vaccinated. Countries will set different safety thresholds before offering the vaccines to their populations, and there is very limited supply of the vaccines at the moment. Eventually, vaccination efforts will expand to target diverse population not typically reached with immunization programs both across and within countries. Requires targeted and tailored strategies as well as management of expectations. So ito na po ang ginagawa ng ating mga health professionals ngayon. Ito na po ang ginagawa natin. It's just a matter of being involved. It's just a matter of getting right information so we can be part of that vaccinated population. What is our goal? Our behavioral goal is to achieve high and equitable uptake of COVID-19 vaccine by the general population. So what do we do to achieve this goal? Offer the vaccination, plan how and where to offer the vaccination, tasked with maximizing uptake using strategies such as persuasion and the use of trusted endorsers or validators, influencers. So this is where the importance of people that we get our information from comes in. Because if the people, lalo na po ngayon, marami po tayo mga influencers, marami po tayo, so many people giving their opinions on the vaccines. And these are people likely listened to by the general population. So another targeted strategy is to use these people, to ask these people to get the right and tell these people the right information so they can share the same to the general population. Vaccine uptake and behavioral drivers, necessary knowledge. So how do we do this? Create an enabling environment. Make vaccination easy, quick, and affordable, and in all relevant respects. You harness social influences. Focus on people who are particularly trusted by and identified with members of relevant communities. Dito po tayo magkakamin sa DepEd dahil po ang mga teachers ang isa sa mga pinaka-trusted na people sa ating bansa. Kaya po, very important for us to get the right information so we can tell them, the rest of the public as well, that vaccines are good. And increase motivation, open and transparent dialogue and communication about uncertainty and risk, including around the safety and benefits of the vaccination. Engage with local community to develop and implement tailored strategies to support vaccination uptake. Work in partnership with communities, build trust, and ensure that messages come from trusted endorsers. And as local circumstances change over time, drivers of people's behavior will shift as well. And essential to consider local context when judging the relevance of information. Critical to obtain and use accurate, up-to-date evidence and consider new knowledge as it emerges to help shape forthcoming policies. So ito po, ginagawa po natin ang orientation na ito para po kung may magtanong sa inyo whether or not ask you about the vaccine, you already have a knowledge about it, the benefits it gives, and what are the possible side effects. So hindi na po tayo operating on a vacuum, hindi na po tayo operating on haka-haka lamang. Meron na po tayong isasagot sa mga parents natin, sa mga learners natin regarding the vaccines. What are the key messages? When in doubt, ask. Huwag po tayong maghihiyang magtanong. May advertisement dyan, di ba? Huwag mahihiyang magtanong. So, dapat po nagtatanong tayo ng mga tamang tanong at tayo po ay nagtatanong sa mga tamang tao. Develop and align messages and platforms across public and private sectors, communication and advocacy, training, etc. There is just so much noise. We are getting a lot of noise. We're getting a lot of information, influx of information here and there. So what we have to do is be mindful of what we do and what we have to say. Identify, empower, and multiply champions. Mga guro, mga kaguro, mga ka-DepEd, tayo po ang mga champions. Sa panahon ng pandemya, isa po tayo sa mga frontliner, isa po tayo sa mga dapat magpakalat ng tamang impormasyon sa ating mga tao. Tayo po dapat ay source ng tamang impormasyon, hindi misinformation, hindi disinformation, tamang impormasyon. Your opinions, views matter. Watch out for the dangers of being misinformed, uninformed, and underinformed. Activate LGUs and communities, public, private, CSOs, and NGOs. Sabi nga po ni Ma'am Amy kanina, when you are asking kung when you schedules, go to the LGUs, ask them because they are the ones equipped to give us the right information as to scheduling. And we also have local health providers that will give us the right information or thorough information regarding the vaccines and the COVID-19 itself. Mga paalala po, 4 dapat. Ito po ang mga dapat nating mga i-observe in our daily lives while the COVID-19 is still ravaging through our country and through the entire world. Air circulation and ventilation, physical distancing dapat 1 meter or more, always use face mask and face shield, and time of interaction should be less than 30 minutes po sa atin. I know po na marami na sa atin ang gusto na pong mag-travel, marami na po sa atin ang gustong maging makihalubilo sa ating mga kasama, sa ating mga kaibigan, sa ating mga pamilya. Pero andito pa po si COVID-19 at dapat po tayong maging mindful po ng ating mga actions hanggang sa maging safe na po talaga tayo. We have to be careful po. Increasing naman po ang ating mga cases dito ngayon. And a lot of these cases happen because a lot of people has joined birthday parties, weddings, mga different kinds of gatherings, di ba? So let's be mindful po. Dapat we have to be very, very strict with our health protocols. Yes, ang bakuna laban sa COVID-19 ay hindi lang para sa inyo. Ang bakuna ay para rin sa proteksyon at kalusugan ng pamilya, kaibigan, katrabaho, komunidad at ng ating buong bansa. Health is a fundamental human right, as I have said a while ago. People and groups who experience health inequalities lack power, both in all aspects, political, social, and economic. Interventions such as vaccination programs need to be effective and sustainable. Isa po dito is kung meron na po tayong 1 dose and it's a 2 dose, you have to get both doses or wala pong silbi ang ating pagpapabakuna. Access to the vaccine alone is insufficient. Systemic changes, i.e. policy reforms, changes in economic or social relationships are imperative to help empower all of us back to safety and marginalized groups and to ensure that no one is left behind in this combat against the COVID-19 pandemic. So, yan lang po ang aking discussion for today. I hope na ito po ay nag-encourage sa inyo na mag-encourage sa inyo na magpa-vaccine. Ito po ay mag-encourage sa inyo na kumausap ng mga tao na hindi po sure kung gusto nila magpa-vaccine. Teachers, DepEd personnel, give the right information, get the right information, and let us help combat this pandemic to its end. Thank you for everything. Thank you for listening to all of us.
Okay, thank you so much, Ma'am Therese Camacho, no, for really enlightening us with about infodemics and where and when to get the right information and who to get the right information. Daghang salamat kayo, Ma'am Therese. So guys, we have already finished all of our session for this morning for the COVID-19 vaccination orientation, but we would still be entertaining questions from the different live viewers coming from the whole province of Zamboanga del Sur. So I will be answering questions that were thrown during the series of talks, no, or sessions that we have this morning. So this is the first question. What is the best vaccine for an individual that has a maintenance? So mga ma'am and sir, the best vaccine is the one that is already available, okay? Because all of these vaccines undergone researches, okay? And they will not be given any authorization if these vaccines are not safe. But because the FDA have already given them emergency use authorization, meaning that these vaccines have already undergone series of researches that would tell us that it is really safe for everyone to be given this vaccination. Okay, another one. What might be, I'll wait for a while. Dr. Punsalan said that when a person experiences light body response after being vaccinated, shows that our immune system is being responsive to the vaccine. How about yung walang iniinda or normal lang after the vaccination? Can we say that it has no effect? So our bodies react differently. What is important that our antibodies, what is important is that the vaccine is potent and the cold chain is maintained. Dapat lang, if ever you do not have any mga reactions after being vaccinated, it does not mean that your antibodies are not working. Siguro, ganun lang talaga kaganda yung immune response ninyo that you do not experience any adverse reactions or mild symptoms, mild reactions, okay? But what is really important that the potency of this vaccine is maintained through this cold chain. So our health workers are very much sensitive in maintaining the cold chain of these vaccines, okay? So another question, this is coming from Baluno Elementary. Good morning po ma'am, pwede po ba magpa-vaccine ang mga teacher, mother na nagbe-breastfeeding? Yes po, our dear teachers, if you are breastfeeding, our COVID-19 vaccine is still safe for our teachers who are breastfeeding. And I guess I've also read another question here kanina, no, I was not able to mention it, about a teacher who is 1 month pregnant pwede po daw bang magpa-vaccine? But according to Doc Germaline kanina, if you are in the first trimester, if I am not mistaken, you will not be able to receive the vaccination. Ide-defer po muna kayo. But after you have already surpassed the first trimester, kung sabihin natin first trimester, that is from first month to third month of your pregnancy. After surpassing the first trimester, nasa fourth, fifth, and sixth month and beyond, pwede na po tayong magpabakuna. Okay? It is still safe for our pregnant mothers, but not on the first trimester. Bakit hindi sa first trimester? Sabi nga ni Doc Jem, it's because that's the time that the critical, or I mean the organs in our body, especially in our brain and in our spinal cord, it is the time that it is already developing. Doon po ang development ng mga organs ng ating body during the first trimester. Kaya nga no, we should be very careful on giving medications for women, especially on the first trimester. Okay. Another question coming from SDO. What to submit to prove that I am obese so that I will be listed in A3 priority? Aba, may mga ganung question. Okay, so during profiling, the health worker or the nurse assigned in your area can already determine if you are obese by determining the BMI. And how do you get the BMI po? You will have to get the weight and the height of your height so that you would be able to get the BMI, okay? So pwede pong obese. Actually, I have already got my vaccination already, di ba? So rest bakuna na po tayo. Okay, next. How long the efficacy of the vaccine? The efficacy of the vaccine is still undergoing study kung hanggang kailan tayo magiging safe if we are being vaccinated with this COVID-19 vaccination, okay? So what specific sanctions should our division office do to our teachers who are still hesitant for the anti-COVID vaccination and keep on forwarding video clips, conspiracy theories, and confirmed issues and baseless assumptions toward vaccines? So far, parang wala pa naman talaga tayong mga memorandums or any letters that telling us any sanctions na to do with this kind of teachers who are sending mga video clips or mga informations that are baseless or hindi natin makikita na walang research na mga studies na mga video clips. But you have to contact your district nurses for the clarifications and to also park your questions on the link that will be given, which is bit.ly ZDSAS, and we will be really answering your questions every now and then. So most likely, no, for those teachers who are not willing enough to be vaccinated, yung masasabi lang namin no, as health workers, you should just be think it over, okay? Because vaccination is actually voluntary. Kahit ano pong klaseng vaccination, mapa measles man yan, mapa polio man yan na vaccines or any type of vaccinations that we have, it is really voluntary. Okay? But what do I like to emphasize today is that when you will become vaccinated already, you are actually helping the nation and even the whole world to achieve the herd immunity. And that is only the reason. And then, I mean, that is only one way of us helping each other for us to go back to our normal life, okay? Kasi dun lang talaga matatapos itong pandemya if we can achieve the herd immunity. Sabi nga kanina ni Therese, only around 50% most likely are going to say yes or wanted to be vaccinated. But the thing is, we have to achieve the 75% and above of the population to be vaccinated so that for us in order to achieve the herd immunity. So if maraming hindi magpapa-vaccine, so kailan tayo matatapos with this pandemic? Okay? So the earlier that we can achieve this herd immunity, the earlier we can go back to the normal life or to the normal situation. Okay? Ano pa bang mga question dito? Hindi po lahat ma-answer namin ha. But as much as possible, we would really like to answer all your questions. So, kailan ang schedule ng vaccination ng mga guro? So, ongoing na po tayo sa A2 priority. So, sabi kanina ni Ma'am Aimee, yung DepEd personnel is nasa A4 priority. So, for now, A2 priority na po tayo, senior citizen. But if may mga guro na under na senior citizen na, they can be included in the A2 priority. Ang next naman po, yung A3 priority, yung mga comorbidities. Okay? So, kung may mga comorbidities tayo na mga teachers, sabi nga ni Ma'am Aimee, just give them a parang proof from your doctors that you are having this kind of disease or comorbidity so that you would be included in the A3 priority. But in A4 priority, lahat po ng DepEd personnel who are willing enough and responsible enough to take on the vaccination, you will be part of that po. Okay, next is, why does our government focus on vaccine and not on the medicine for the virus? Wala bang tambal pamatay sa virus? Okay. So siguro no, we are really focusing on this vaccination because virus are not killed through medications. Remember, virus are self-limiting. When you say self-limiting, namamatay lang po ito sila. Okay? But it takes time for the virus to, ang tawag dito, para mamatay. But by the time na nasa body sila natin, it does damages. Okay? So by the time na andun pa siya sa body ninyo, it will do damages. If wala kayong immunity to that kind of virus, to fight that virus, and mas tatagal pa siya sa iyong body, then there will be greater effects. Like magiging severe yung mga nararamdaman natin. Kaya nga sinasabi natin, no, prevention is better than cure. Okay? That is why the government is focusing on vaccination, because vaccination is a preventive way to have this COVID-19, to make it more severe na nagiging hospitalized na tayo. So wala po talagang mga medication that would directly kill the virus because virus are self-limiting. Kagaya lang po yan ng mga colds or mga kanang sipon bitaw or ubo nga caused by virus. Di ba? We do not take anything na para to kill the virus, but we actually take medications to answer the symptoms or to alleviate the signs and symptoms that we are experiencing. But if we are vaccinated, di ba, nagiging lesser yung mga sintomas natin. For example, with this very kanang effective na vaccine that we have on the past, we have our measles vaccine, di ba? Actually, the measles, hindi talaga siya totally nawawala. Even if we are vaccinated with measles vaccine, we still get the measles. But if you are vaccinated with measles and then you get the measles, hindi ganun kalala yung mga symptoms na nararamdaman natin. Nakikita niyo naman yan sa mga anak niyo, no, if they are already vaccinated with measles vaccine and then they got or they acquired such disease, nakikita niyo na parang hindi na masyadong nag-fever or kung nag-fever man, hindi na masyadong yung parang malala yung mga nararamdaman ng bata. That is also same with the COVID-19 vaccination. Okay. Meron pa ba? May sabi pa dito sa mga kasamahan ko, vaccines are also cheaper than antiviral drugs. Okay? Mas cheaper po si vaccination kaysa naman tayo anong tawag dito? Mag-create talaga ng something to kill out the virus, okay? Do we still have any other questions here? So many. Okay, ito gusto ko tayong isagutin, no? This is from Campo 2 Elementary School. In terms of percentage, how many percent safety is the COVID vaccine to us? If there are any abnormalities that may result to hospitalization, can the DepEd or the government will support us financially? Okay, ganito po mga ma'am and sir. In terms of the safety of the vaccine actually outweighs, ang safety po ng vaccine is greater than, I guess, 95% and its efficacy rate. Safety po siya kasi kapag hindi safety, hindi po talaga yan siya ibibigay, okay? But when you say about abnormalities, if there would be, hopefully wala, if there would be any adverse reaction, but hopefully wala po, sabi nga po ni Doktora kanina, you are still covered by the AEFI. So covered po ng PhilHealth natin, ng government natin, any adverse reaction or mangyayari sa atin during vaccination. So covered po tayo, wala pong babayaran ang tao pong magkakaroon ng any adverse reaction during post-vaccination. Okay? Okay, good morning, Doc. How about my case po? I have lung obstruction and I'm still on my medication. I've contacted my doctor but I haven't heard from him yet. Would it be okay if I get vaccinated although I have maintenance? I actually am hesitant to get vaccinated. Okay, so ito po is from Betina National High School, no? So may lung obstruction po siya and he or she is under medication. So with that case po, sabi po namin kanina, no, that is still a comorbidity. Sabi po nga namin kanina, if ever you have any comorbidities, as long as it does not show any signs and symptoms, or if you are okay at that day, okay? So wala pong problema yan. And on the day of vaccination po, andun po yung mga doctors natin who will be assessing our people who will be undergoing vaccination. Meron pong mag-a-assess sa atin kasi kapag nakikita po ni doctor na hindi ka viable for that vaccination, then i-defer po natin yan. So when you say defer, is the stop muna at the moment, okay? Defer, it does not mean hindi ka na talaga bigyan, no? But defer means for them at the moment, hindi muna bibigyan. But maybe in later on, kung kaya na ng iyong katawan or okay na talaga, wala ka ng mga nararamdaman, then you will be given the vaccine. Actually, there are also health workers na gano'n, no, na grabe kataas, tumaas talaga yung BP, let's say 200 plus, kasi may certain BP ata sila na limit, okay? But if that time, grabe talaga yung taas ng BP niya, i-defer mo na siya. He or she will undergo medication. And after that, if the next time that he or she will go back, okay naman, stable na lahat, then he will be given the vaccine already. Okay? So meron pa ba tayong mga tanong dyan? I guess wala na po, no? So we will be also posting our evaluation link, our post-evaluation link, so that you could give us, oh, what is that? Okay, so we have our evaluation link at the bottom of our screen. We have bit.ly/ZDS _doc/DOCVD19V. So nakikita na po niyo yan sa screen natin, no? Ganito pala talaga mag-live, okay, di ba? So thank you so much, guys, for listening and coming through with this online webinar, no, about COVID-19 vaccination. And before I will end this presentation or this orientation for this morning, I would like to say thank you for all of the support coming from our top management, from our schools division superintendent, our 2 assistant schools division superintendent, our chiefs and our school section heads, and to our program management team, headed by Ma'am Glenda Maybon Subre, our nursing service coordinator in the school health section, together with our speakers, Dr. Jermaline Punzalan, Ma'am Amy Alonso, and Ma'am Therese Camache, and to the production team who make this live possible for this day. The team of Sir Chester, I will not be mentioning them all, but thank you so much, guys, for always supporting the school health section and for giving us this kind of venue, no, to give information to all of the DepEd personnel, teaching or non-teaching personnel of the Division of Zamboanga del Sur. And also, before I will end this one, I would like to say happy birthday to one of our colleagues here, Ma'am Glenda Doliente. Happy birthday! O, diba? Working on her birthday talaga. And also to our school health section, belated happy birthday din po kay Doc Bing Manso also. Happy birthday, Doc. And I wish you all good health for everyone. Maraming salamat po. And this is your host for this morning. I'm Kirstine Eileen Dueñas Sabanal, saying that you have to be responsible and be part of the solution. Tayo na po at mag-rest bakuna. Thank you so much, and once again, good morning.